Good morning, everyone, and welcome to the regular meeting of the Multnomah County Board of Commissioners. Audience members, I want to start by asking you to please silence your electronic devices. I would also like to remind you that in addition to the audience in this room, we have people watching and listening online. So please consider your language in comments and testimony today. Today's meeting is a hybrid board meeting. Some presenters and guests will appear in person and some will appear virtually. For those presenting virtually, please mute your mic when not speaking, and when presenting, make sure to unmute your mic and turn on your camera. For those joining us in person to provide public testimony or to present, please turn your mic on when you begin speaking so the green light is showing, and off when you've completed your remarks so the red light is showing. And for all presenters, please state your name for the record before speaking or responding to questions. May I have a motion on the consent calendar?
Good morning.
Second. Good morning.
I have a question. I want to have a conversation.
About the consent calendar?
C1.
So you would like to pool C1?
Yeah.
Okay, so we have it is just pooled. There doesn't need to be a motion. Okay, so can I have a motion to consider the consent agenda C2?
Second.
Okay, so we have a motion to approve consent item C2. All in favor?
Aye.
Aye. Okay, great. The consent calendar, consent agenda for item C2 is approved. We will hear public testimony and then we can go to C1. All right.
Opportunity for public comment on non-agenda matters. This is a time for the board to hear public testimony, not for board deliberation. When it's your turn to speak, I will call your name and unmute you or call you to the presenter's table. I will set a timer for 3 minutes when you begin speaking and announce when your time is up, at which point, please wrap up your sentence. We have 6 people signed up for verbal testimony and received 4 written testimonies, which were shared with board members and staff. I'm going to start with virtual testimony, which is Kristen Harbert. Kristen, you can unmute yourself and begin.
Hi, I am Kristen Harbert. I don't know what is happening. It tells me my video has stopped. I'm going to try and fix that. I apologize. But I am here speaking in regards to our represented staff members, particularly those of us who do not make a living wage. There are hundreds of us at the county who currently do not make a living wage, and as we continue bargaining, that the proposal that has been given is not a living wage. Most of us who make these wages work directly with our community members, while there are non-represented staff who make 6 times as much as our lowest paid staff, who rarely ever interact with our community at all, if ever. We all know we are in very trying times right now, and that is even harder when you are making just $20 an hour. And we know that it's going to get harder, and we know that there's more work that's going to be coming on, and it always rolls down onto low-wage staff. And so I'm here asking you, commissioners and chair, to please engage with us and realize, like, we need to have our basic needs met. And what we make right now, we struggle every paycheck. I've got $300 in my account right now to make it through to my next paycheck. And I've been here almost a decade, and that is my reality. And that shouldn't be the reality for those of us here working government jobs. A government job used to be a great thing, and you know, you can support yourself, and we're not in that space anymore. And I'm just asking, that you consider that we have needs to meet. My cat, if you heard her, would like you to do so as well. And we need more than just a 2.4% COLA to have our basic needs met. Thank you.
Okay, next we'll have in-person testimony. When I call your name, please come to the presenter's table. We have Angela McCulloch. Jessica Croson, Ryan Owens, and Megan Gallagher.
Good morning. You can begin whenever you're ready, whoever's going first. Usually we start with somebody at the end. Oh. Okay, then Angela. You're fine.
Hi, I'm Angela. I've worked for the county for 25 years, and there's a lot of things going on in the world, and I would like to request that we have a contract. We have staff who are showing up every single day and doing really hard stuff. The job has changed so much. Right now I'm covering for 4 co-workers who have left. We're losing good people. I think it would be a great demonstration of your faith in this community and your staff if you put us first. Oh, maybe second, whatever. But please, that's it. Thank you.
Good morning. Jessica?
Hello, my name is Jessica. I work in the medical examiner's office as a medical legal death investigator, or an MDI for short. I want to address the need for trauma leave and why it is a necessity for Multnomah County employees by talking about MDIs. I'm going to talk about death. Some of what I say is hard for people to hear, but these are realities that we see daily. The intention is not to horrify or shock anyone, but it's to be honest about the roles that we have in the community and how we may be impacted by them. MDIs work anywhere, anytime, rain or shine. We investigate all deaths, natural accidents, suicides, things that we sometimes don't know what has happened. We do external exams on deceased individuals. We collect biological fluids, we do photography, write reports, review medical or police records. We speak with a lot of agencies and we notify families. And as much as we all wish that the decedents that we see are ones who have lived long, healthy lives, the fact of the matter is death is not prejudice. Doesn't matter where you're from, it doesn't matter what your family looks like, and it doesn't care how old you are. 3 minutes is frankly not enough to talk about what we do, but I have a list in front of me that I would like to read off to you. These are tasks that my colleagues and I have done and we will continue to do and see in our roles as MDIs. Help recover deceased individuals from under trains, on the sides of highways, or from water. Cut down people's loved ones from ligatures. Access crawl spaces to retrieve skeletal remains. Help to remove deceased pets from scenes. Maneuver through hoarding conditions or areas with vast rodent and insect activity. Do interviews and reenactments with parents after the death of their child. We often cradle these children in our arms and place them in a bassinet as we carry them away from their home for the last times. Obtain fingerprints from heavily decomposed decedents. Locate and count gunshot or stab wounds on individuals. Rapidly return to work to investigate deaths after we've lost our own family members. Try to find the right words for families and hold the hands of strangers who reach out to us. We are sometimes screamed at, cursed at, and on occasion we are threatened by those who are understandably too distraught to separate us from the events that have taken place. Our bargaining team has done our best to present what we feel are reasonable views to support employees who face trauma at work, such as MDIs, among many others who have difficult jobs in the county. And so far, county reps have not shown any desire to consider our ideas or even propose alternatives. We believe there is an area for mutual agreement. I thank you for your time and hope that you can see the value of showing employees that the county will support them, especially when they need it the most.
Thank you.
Thank you.
Good morning.
My name is Ryan Owens. The represented employees in Multnomah County currently face and have historically faced chronic understaffing. This forces each and every employee to do more with less. resulting in employees having to work below minimum staffing, multiple overtime shifts week after week. We've even seen this result in lower classification employees having to make decisions that affect entire departments. All of this work is completed by a dedicated workforce who operate on the edge of burnout. With no tangible recognition from management, these conditions are no longer sustainable. These conditions are exacerbated by the wages paid to Multnomah County employees. Low wages make it impossible for us to attract and keep well-qualified and competent workers. This inability to hire and retain well-qualified workers results in two major issues for the county. The employees who remain and who are the backbone of what Multnomah County does are required to work the positions of multiple employees, which does result in burnout and poor performance. When we are unable to retain employees, not only do the ones who remain have to do the work of those who left, the county loses out on vast amounts of institutional knowledge that the departing employees take with them. This makes it impossible for the citizens of Multnomah County to receive even competent service, much less the exemplary service they deserve. With the vast majority of represented employees struggling to make ends meet, we have not seen wage increases at a pace that even begins to keep up with inflation. We have seen the cost of rent increase at a rate of 10% a year, inflation go through the roof, and taxes increase. Yet, the county believes a 2.4% COLA is fair and reasonable. I am here to tell you that it is not. We currently have over 600 employees who don't even make minimum hourly rate for a living wage for a single person in Portland, Oregon. For these employees, a 2.4% COLA equates to a 48-cent an hour increase. This will do nothing. For myself, as the single earner for my family, my disabled wife, and my daughter, the reality of wages not keeping up with inflation, even with the vast amounts of overtime I'm required to work, has created hardship and financial insecurity. We routinely have to make decisions on which bills to pay first, how much we can spend on groceries, and how to help our daughter afford college. Not even to mention trying to save for emergencies, home repairs, or retirement. While speaking with the county about wages and the increase, the union was told that, quote, Multnomah County pays a market wage, not a living wage, unquote. I find this way of evaluating what is appropriate for the county to pay employees very disheartening. You have a workforce that is doing everything they can to provide exemplary service to the citizens of Multnomah County while having to endure stressful working conditions and financial uncertainty.
Thank you. Good morning.
Good morning. Hello, Chair and Commissioners. My name is Megan Gallagher, and I'm on the Executive Board of AFSCME Local 88, and I'm also on our bargaining team. I was on our bargaining team previously in 2017 as well, and feel confident saying that this round of bargaining has been different. And I am asking you all to direct the county staff leading bargaining to come up with proposals that give Multnomah County workers the dignity and respect they deserve. From denying us living wages to literally laughing at us at the bargaining table, your current team has been a poor representation of the county's mission, vision, and values. As a worker with disabilities who is also the parent to two amazing little girls, including one who is autistic, being allowed to use my accrued leave without any penalty is very important to me. The county bargaining team has consistently insisted that they be able to discipline people for excessive sick leave usage, including when people still have earned leave in their banks. Between my own health issues and having two young children that bring home all the little kid germs, I'm always running low on sick leave. It would be wonderful to not have to stress about my sick leave usage while I'm dealing with my own health issues or those of my kids. The policies and procedures around excessive sick leave usage vary from department to department, with many departments sending out threatening letters that discourage members to utilize their sick leave. This encourages sick workers to come into the office and spread serious diseases such as COVID to their coworkers and clients. And it encourages individuals to potentially neglect the health needs of themselves and their loved ones. This impact is magnified for individuals with disabilities or those with disabled family members. Ensuring that individuals will not be disciplined for using accrued sick leave for sickness or medical care is vital to ensuring that our workplaces are safe, healthy, and equitable. All of our workers deserve to feel respected and safe in their workplace, and I would encourage this board to ensure that their bargaining team is bringing proposals that treat AFSCME Local 88 members with the dignity and respect we deserve. Thank you.
Thank you.
Okay, last up, we have injured and pissed off.
Good morning.
The name is Injured and Pissed Off. I had a conversation with people last week here in the room after I was denied being able to sign up to speak. I explained to the staff or receptionist of the board, of the chair board clerk, one of your receptionists was back there, and as well as the security. I told him that this is discrimination for a blind person to have to sign up because I can't write. I've even got a broke thumb. And I brought this. I was, of course, not able to sign up today even. They assured me that I'd be able to sign up and talk, but I brought this, making healthcare work for absolutely everyone. If you remember, I was right here earlier this year saying that Good Sam and the care facility that I was at didn't want any medical records of my spinal cord injury. They didn't have any and didn't want any from OHSU. And I still haven't received any kind of medical treatment. What do you mean absolutely for everyone? I canceled my Medicare Part B back in 2017 when I changed my name because of the lack of health care. And of course, well, I got injured by the county and the city. The city owns the apartment building. They wouldn't enforce the service animal laws. They won't enforce even discrimination. It's against Oregon law to even interfere with the service animal. They knew that. Even the chair, Ted Wheeler, when he was here, wrote a letter saying that the dog would be potentially dangerous. And it was declared there was 2 more dog attacks after that. And of course, the chair at the time, Jeff Coogan, was a drug user. And so big deal. Oh, just ice for me. And oh yeah, the super medical treatment. I'm 4 inches shorter than I used to be because they twisted my spine, ignoring the spinal. The 2 fractures, T12 and L1, and doing hip surgery on me. And of course I have TBI, traumatic brain injury from that, as well as balance.
Thank you.
Nobody's above the law, they say, but Multnomah County certainly is.
Okay, now we can move on to C1. First and second term appointments of Departmental County Budget Advisory Committee.
Thank you. Can I have a motion? Commissioner Singleton moves, Commissioner Brim Edwards seconds. Approval of C1. So this is the first and second term appointments for departmental community budget advisory committees. Commissioner Moyer?
Yeah, I have some questions and concerns. I actually super appreciated getting the demographic information. That was wildly helpful. And I have no objection to any individual on the list. It is simply a concern about how appropriate the representation is on our CBACs, and I'm not seeing anyone from the office.
Well, so we didn't get a heads up about this, so we're trying to get Amada on virtually. Is she able to, I believe she's able to join virtually.
Okay, I'll continue and,
Sorry, Tejo, she's
here.
Okay, great.
okay. Some of my concern is, although I'm always thrilled to see District 1 well represented, I do believe my district might be a little over-represented. But areas that I am concerned about is, it does seem to me that District 4 is pretty significantly underrepresented, as well as we have no marker or do we seem to track members of the LGBT, well, yeah, we have trans, but we don't have lesbian, gay, bisexual, or any other letter of that alphabet represented, which I don't really understand why. But I think the thing that I find most concerning is a pretty significant across the board, although to be fair, there are a few departments that I think really did a good job of trying to reflect their communities. We have an overrepresentation of economically well-off individuals on our CBAC. Specifically, my areas of concern are departments such as our health department, where 33% of the CBAC members make over $200,000 a year. I don't think that's very representative of the community receiving services from our health department. And this may just be a reflection of current practice, and we're working on this, but I see some of this, and I didn't want us to just approve it without having a conversation about how we're trying to reflect the community that interacts with these departments and would have, I think, valuable feedback. I also see some really large gender disparities. The district attorney CBAC is 83.3% male. That's really concerning to me. The health department is 88.9% female. So I just wanted to take a moment for us to look at this. Again, I couldn't be more happy to have this information, which we haven't had in the past, so I'm very grateful. But I do want us to be on the record pushing for our CBACs to be more representative of our community and who is accessing and using the services of that department.
Thank you, Commissioner Moyer. I appreciate shedding some light on this, and I do want to appreciate Amada Perez, who's on who is available to answer questions or give comments for the increased outreach that has happened over the past year to try to bring more folks in. And I think it's always good to pay attention to what's happening. And Amada, so I don't know if you want to provide any insight into what the recruitment process looked like this year or reflect to Commissioner Moyer's comments. And then, well, yes, we can have a conversation with the board as well. And Amada, you're still on mute.
I'm going to try and unmute you. Give me 2 seconds.
Okay, well, while we work on that, Commissioner Singleton, if you had additional comments you wanted to give.
Thank you. Because I appreciate you raising this, and I had planned to do some follow-up. One, just appreciate the information coming out. I know that was challenging to go back and collect, and I know moving forward we'll get this regularly, so thank you for hearing that and making that adjustment. I wanted to add that I particularly was planning to reach out after the meeting to talk about public safety. We have almost all upper income white men on our public safety committees, and we know that is not who is impacted by those departments. And so I think it's really critical that we attend to that. And I don't necessarily need today a plan for intentional recruitment, but would like to know if we're able to get her unmuted, how we can support the DA and the sheriff in doing some more intentional recruitments so that our public safety committees in particular are more representative who are impacted by those two departments.
Thank you. And so any other comments? I'll give Amada the chance to reply, but just wanted to say, okay.
I think, can you hear me now?
Yes, thank you.
Oh, thank you. And I appreciate you raising these issues. This summer was our first time using new systems and new practices, and we had a really robust 2-month outreach plan that did more than we had in the past. And so, but this is our first time. We had 47 vacancies and actually selected 30 people from those outreach activities. And so we do recognize that D4 is underrepresented. We are, as you know, moving to do recruitment all year round. And so in our fall recruitment activities, we will be prioritizing and targeting our outreach and recruitment to D4 to help address that issue. We do track sexual orientation in our database. The reason why it was not included in this report is that that was not a dimension of diversity in CBAC code, but we are happy to include that. We have in code specific areas that have been sort of identified as preferences, and so we just stayed true to code. But we can definitely enter that. We can actually follow up with you, Commissioner Moyer, in the next couple of days and give you those numbers. I will say among all the dimensions of diversity, that is a question that most people don't want to answer. And so we have, probably about 10 people who actually didn't answer that particular question, but we do ask it on the application and we can include that in our report. So I just wanted to offer that context in terms of both this being our first time doing outreach, how we've been tracking that, our emphasis to focus on D4 in the fall, which will be in the next month, and then being able to add that to further reports.
I appreciate that. And I totally want to acknowledge that this is a work in progress, and many of the things that you're working on, we just didn't do in the past. And so this is not a criticism. This is just wanting to make sure that the commission continues to prioritize accurate community representation. And I appreciate your efforts, and I look forward to seeing this progress.
Thank you for that.
Thank you. Commissioner Jones-Dixon.
Yeah, I just want to say thank you, Commissioner Moyer, for flagging this. And then I just wanted to piggyback off of what Dr. Perez has mentioned. She's reached out to my office specifically around disengagement and sent out the materials to share with the community partners out there in District 4. I do want to also share that I gave a talk to a group of youth violence prevention outreach workers, and they were asking what are the ways that they can engage with the county and in this work. Like, as you mentioned, as you flagged, like public safety around DCJ and the sheriff's office, they need an invitation. So we're on the right track. Thank you.
Thank you. And I think the other thing to recognize is that people self-select which CBAC that they want to participate in. And so that might also be something for further discussion down the line is, of how can we, both through recruitment, but also maybe through, having a pool of folks that we, based on the needs of the different CBACs, like who has fewer members that might need more, so we can talk about that. I appreciate the conversation, and Amada, I do appreciate all of the work. Yeah, Commissioner Singleton.
I do, and again, I don't need the answer today, but Amada, can we follow up on how we can be supportive? Because I know we don't run the DA and the sheriff CBACs in the same way that we do our departments. But I do think that that is critical, and I think, Chair, there's something to be learned about the self-selection of asking some questions of folks of why they may not have selected others, because if there's a culture piece that's happening on CBACs that is dissuading people from picking those, then we need to talk about that too.
Can I just add to that on the application, folks are asked to give choice, their first, second, and third choice. And even when, if those third choices aren't met, they are asked if they are open to other departments, and many folks are. Rarely do we have people who say, no, I can't have my 3 choices, I'm out. I think people just don't necessarily know about the other departments and what those departments do, and that is often a barrier to selecting some of those departments.
All right, thank you, Amanda. I believe we have somebody signed up for public testimony on this item.
Yes, we have Lightning and Charles Johnson.
Good morning, Commissioners. I'm Bridge Crane Charles Simca Johnson, and the mics are spicy today. Thank you, Commissioner Moyer, and also thank you, Chair, for noticing this. I think that what I've learned from the county process is that we need to attach this conversation to a program offer number. That's how things get done, and that's how we find the FTEs and stuff to make sure that this happens. So I hope that if I have informal conversations with you later, that you'll be able to talk about what kind of budget does Amara Perez have to staff this important work. It's kind of crazy to think that the Community Budget Advisory Committee for the sheriff might be less diverse than her workforce. That's kind of weird, because we know that getting diverse and equitable hiring in the law enforcement industry is a challenge, because sometimes minority candidates find that to be almost a hostile workplace, not necessarily in our county, but maybe in others. So yeah, lots of room to work on the intentional recruitment. It was a little weird to think about one of the remarks that passed through here, that in Multnomah County, are queer people really not uncomfortable disclosing our queerness on the form? And why? That actually needs to be specifically addressed. Some of us that would identify with that community know the importance of getting on there, just like we would encourage people of color to mark their reps so that we can have a better idea of if we're really getting to things that, no matter what Washington, D.C. says, diversity and equity, as we'll talk about on another agenda item, are important, because the people serving the community should get a living wage, and they should be a demographic match for the community that they're serving. So in addition to Commissioner Singleton's great focus to try and get things done on this when the board's not in session, I hope that you'll also have a space right here. And I will say that as a person who gets county services, even though I now live in District 1, I think I've been moved away from the mid-county dental clinic. That right there is where you need to do recruitment. Everything I see from the county should have a QR code or a short RL that says, we value you, you can use your voice, and link to the website, where all throughout the year, people, while they're sitting in the waiting room, can look at that and be like, this sounds kind of crazy, weird, masochistic, but I will fill it out. I will try and join the CBAC and other community advisory committees. And then when we'll talk, all this conversation is focused on CBAC, it should be blended with the other advisory committees that exist. So thank you all for your time. Unfortunately, I'll be back.
Thank you. Good morning.
Yes, my name is Lightning. I represent Lightning Super Lab. We the people. Now, of course, I agree that we should have representation through the communities, very diverse representation of all people. Of course, who wouldn't want to have that, even income levels? But you know, when we're talking about the budget itself, your budget is upside down. because of the policymakers. And what I'd like these budget committees to also start focusing on is the national debt. If you don't focus on the national debt, the $37 trillion, your budgets are going to be so upside down you can't even see straight. Now again, as you know, we invested a 10% interest in Intel, 422 million shares, approximately $10 billion value, which I want the people doing the budgets to understand. In the last 30 days, we made $5 billion. We, the people, on Intel. And I want you to think about that for 1 second. That's more than your whole budget at Multnomah County. Think about that. We just made that in 30 days. We, the people. Now again, what I have stated on the national debt, the $37 trillion, we need to buy that down rapidly. And why we weren't doing this 20 years ago in investing in these corporations, instead of giving free money grants to these corporations, we were taking an equity interest. I'm going to say to you, we would have no national debt right now. And I want you to think about this. We pay $1 trillion in interest every year. Divide that by 50, all the states, that would be coming down into your budgets. Coming down into your budgets. So when you talk about the budget, for you to think that you don't have a responsibility with the federal government on that $37 trillion debt, think again. Think again. That is why your budgets are upside down right now. That is why these people who want to raise that were in here from the unions can't even get a 2.7% COLA, okay? You wouldn't have that problem if we would have been taking an equity interest in these corporations instead of letting them be a welfare corporation and then putting the debt on the backs of the people. Free money grants don't work at the federal government. $37 trillion in debt. Think about that, Budget Committee. Think about it.
All right, thank you so much. We will now have a vote on C1. All those in favor? Aye. Aye. Yes. Aye.
Sorry, I said aye. You might have looked that way.
All right. Well, for consent agenda items, I thought we would just do it more quickly, unless you.
No, that's okay.
Okay. Yeah, just mixing it up. Great, so the consent agenda item C2 passes. Great, Tasia, can we move on to R1?
R1, resolution approving the project plan for construction for the Rockwood Community Health Center upgrade project per the Fact 1 administrative procedure.
Can I have a motion? Commissioner Brim Edwards moves, Commissioner Moyer seconds, approval of R1. Good morning. So today we are looking at a resolution approving the project plan for construction of the Rockwood Community Health Center upgrade project, which will authorize the next steps in project delivery, including the construction work for this project. So I want to give a huge shout out to the work of our Department of Community Assets and our Integrated Services, Clinical Services team for all of the work that's gotten up to this point. So thank you so much for being here with us this morning, and I will turn it over to you.
Thank you, Chair. Vega Peterson, Commissioners. We'll start with quick introductions. I'm Brett Toddy. Use he, his pronouns. I'm a Senior Project Manager with our Facilities and Property Management Division.
Hi, Commissioners and Chair. My name is Anirudh, he, him pronouns, Interim Executive Director for the Health Center.
Good morning. My name is Debbie Powers, and I'm the Interim Chief Operating Officer for the Health Center, and I use she, her pronouns.
Thank you for welcoming us. Let me start over. Thank you. We're seeking approval of the Fact 1 project plan for construction for the Rockwood Community Health Center project. Next slide, please. This morning, we'll share background related to this project, an overview of the health center, certainly work that's been done to date in the development of this work, the project attributes with the scope, schedule, funding, and budget, and then certainly conclude with our board request. And with that, I'll hand it to Anna Root for overview of the health center.
Thank you.
Good morning.
Next slide, please. So I get to talk about our Rockwood Health Center. Commissioner Jones-Dixon, it is in your district, D4, and Chair, this was one of the first signatures that you did when you started as the chair in 2023. A little bit about our Rockwood Health Center. I'm not going to read what's on the slide, but just some statistics for this board's consideration. In 2024, at our Rockwood Health Center, we saw 6,700 clients, and of those clients, 40% of those clients identified as Hispanic, and 25% of the clients identified as white, and 10.5% of the clients were Black African American, and many other race ethnicity identification. And then also about 1/3 of the clients that we serve at the Rockwood Health Center speak Spanish as their primary language. And in the next slide, we talk a little bit about the background, including the 2023 purchase that I referenced at the start of the conversation. We purchased this building from Care Oregon in 2023. However, we were leasing the building from Care Oregon prior to that. And there was a clinic interior renovation that happened in 2010. I will pass it back to you.
All right, thank you, Anna. So just to share some background on the development of the project needs. Just background on the facility, it was constructed in 1975. And shortly after our purchase in 2023, the Facilities and Property Management Division did a facilities needs assessment. So looking into the condition of the building, identifying many of the aged systems that were existing, some challenges around the lobby and some of the characteristics of that lobby and entryway, and limitations to some of the existing building systems. Through that analysis and assessment, there was a list that was generated of work to be done that was recommended, and through that list of scoped items, they were prioritized, and the top priority items that were identified were then presented in a program offer to the board for the FY24 budget. Next slide, please. Those program offers were approved for that budget, and with that, it initiated the project design. We engaged with Scott Edwards Architecture to lead our design team. They are operating under a service agreement or a service contract with Multnomah County for A&E services, and we initiated the schematic and design development phase of the project. During that work, we were notified and received award of a Health Resources and Service Administration grant. This was something that was proposed through a congressionally directed spending package. And with this additional funding, we identified further down on that list of items that had been identified through the assessment to then bring additional scope to the project. Some of that included the expansion of and the upgrade to the electrical service to the facility. Next slide, please. Oh, I did. Next slide, please. Oh, I'm sorry. Yeah, thank you. So just to share the overall scope for this project, again, through that exercise that had been performed, we were looking to remodel the entrance lobby of the facility. There's challenges around circulation. Presently, unfortunately, there's only a single door, entry door, that when it's opened, the conditions of the exterior quickly become the conditions of the interior. So to better control that environment for both those seeking services as well as the staff, looking to replace the roof, improve worker safety, certainly look at some of those other building conditions or building systems that are listed here. And with this, I will speak to some more of this scope, but I asked the slide to be advanced just so we have a nicer image to look at than a slide of text, if that's okay. So here's a rendering of the new proposed entryway for the facility. So while that's on the screen, I'll share some of the other scope items included. We're looking to replace the cooling and ventilation equipment that's presently on the roof and add some cooling and ventilation to specific areas within the facility, such as the immunization room that has a lot of equipment, as well as the dental laboratory. We're looking to build an electrical room addition that will support the upgraded electrical service and new equipment that will increase the capacity of the electrical system and certainly the integrity of the system. Incorporate an emergency generator that will support the preservation of medical supplies and medications in the case of power outages, as well as doing some other finishes and upgrades to the facility. And also to note, we are looking to add electric charging stations, vehicle charging stations as part of this scope. Next image, please. This is, again, some renderings of the proposed lobby area. So certainly much more open, welcoming. It's not shown in any of these images directly, but the front wall will be turned into a window wall to allow more light into the space, and orientation of the entrance with other circulation paths will just help with the comfort of the space. Next slide, please. Next, I'll speak to the project schedule. So on this image is the entirety of the project schedule from when the board approved those program offers in FY23, showing the process that we've gone through to date. Just to share some recent activities with the project, the construction documents were finalized in August, just this past August. With those construction documents, we then submitted them to the City of Gresham for permit. And working with our central procurement office, they were released for bid in September. With approval of this FAC 1, that will allow us to move forward and finalize those processes and then transition into construction of this work. We see construction taking about 12 to 14 months, and hopefully beginning at the end of this calendar year or beginning of next calendar year. Due to the nature of some of this work, we have worked in coordination certainly with the health department on identifying a 6-month closure period for the facility. And so at this point, as shown on this graphic, it's anticipated to begin in spring of 2026, but until we have our construction general contractor on board, that will determine the exact start date of that, but with a 6-month closure window. I'll now pass it to Debbie, who will speak more to that coordination and sequencing.
Next slide, please. Okay. So initially, we're going to start with some construction on site where we'll still have clients and staff in the building, and those are items that you can do with in shared space. When we move towards that 6-month closure period, 6 to 7 month closure period, I say 6 months because I'm really hoping for 6 months. At that point, we're going to be doing the heavier stuff. As you saw, we have a flat roof here in Oregon, and so there are, issues inherent with that. So we'll be doing the roofing work, the electrical work, a number of things that you just can't do in shared space due to noise and the risk. And then during that time, we'll have our staff and our programming that will largely move to our East County Health Center. That will take place on the 1st and 3rd floors of our East County Health Center, and by that I mean the programming. Dental will have a wider distribution because it's a little bit more challenging with dental chairs. We can't largely move the staff to one site, but we're going to try to keep the program together as much as possible, and that would be at our East County Health Center, with Mid-County as an opportunity if we need additional space. And then the Community Health Center Board has been involved with closure decisions. Back in February, early February, we met to go over a number of options. And later in February, after a significant operational assessment, we did come to the determination with the Community Health Center Board that we would be closing for 6 months and redistributing programming.
Great.
Thank you.
Thank you, Debbie. Next slide, please. So this speak to the project budget and funding. The project budget is $6,840,000. It's shown here and distributed with the direct construction, soft costs, and our owner's contingency that we'll be carrying into the construction phase of the project. Next on the slide is the project funding, speaking to some carryover from the property sale that was in FY26, or property purchase, I should say, apologies. Next, the program offers recognition of that HRSA grant that we mentioned, and then in addition to that, some capital improvement funding that's been brought to this project because of the alignment of some of the work that was planned in the capital improvement plan that aligns with this project, so it has been incorporated into this work. That then, as demonstrated on the slide, shows that we have full funding dedicated to this project at this time. Next slide, please. And then finally, we'll conclude. Our request today is seeking approval of the project plan for construction for the Rockwood Community Health Center upgrade project. And we'll open it up for questions. Thank you.
Thank you so much. Really appreciate the presentation today. We do have public testimony on this item, so if you guys don't mind taking a seat just right behind you, then we'll bring you up for any questions from the board.
We have Charles Johnson and Lightning.
Yes. I mean, vote yes. You're going to vote yes anyway. I'm Charles Simcoe, Bridge Crane Johnson, and hot diggity, I thought that package presentation was top-notch. I even got to see some program offer numbers to notice that the project funding is fully allocated and very intact. Got to hear a shout-out mention that some of the more Greshamized dental people will have an option to go to my formal dental clinic on the FX2 bus. The nitpickiest thing I can say is electric chargers. I'm for the county being involved in electrical vehicle infrastructure, but way more important is that these public health clinics always have awareness of the client's need to use public transit. You know, the Mid-County served by just one bus line. High mobility people can walk down from the blue line. Gresham, better options. So possibly we even need to have some contingency funding, make TriMet Lift aware or whatever for people who have mobility issues that go to this clinic. $6.84 million. One of these days, I'm going to have a miracle, and I'm going to look online at the budget thing, and the summary is going to have dollars on it. So that when you look at the budget thing, we can look and we would know that when we voted to cease collection activity on the taxes, it would have been right there on the front page of the agenda, so people would know how many dollars or hundreds of dollars or millions of dollars of tax collection it seems we gave up on during C2. And the same thing I think would be a better practice on the whole agenda is that any item that is, when we look at R2, there's technically probably some cost to restructuring the D&E office into county management. So I think that it would actually help you with your fiduciary duties if you found an agenda structure that communicated with your constituents about, oh, this is a $6.84 million item, and oh, for some reason, a $290 item is on our agenda. People can decide, I think I'll blow off the $290 agenda item, but they will care about a $6.84 million agenda item. And it will also help you maybe prioritize your workloads, maybe less binders for Ms. Brim Edwards to carry around on some days. So thanks, y'all.
Thank you.
Yes, my name is Lightning. I represent Lightning Super Lab, We the People, X1, X7, X33, 33. Now, what I have a problem with is on this whole project, without actually seeing other numbers, is that when they were talking about the Portland building right next to City Hall, and I think it was Mayor Hale said, why don't we just go ahead and rehab it and fix this old building up? Well, I think, what was it, $200 million later? And that property is probably valued at about $50 million right now. So we, the people, probably lost $150 million on that. Because as we know, the Bancorp building sold for $45 million, so you have to use that as a comparable. So we lost $150 million. Now, looking at this, you can look at these numbers and go, oh yeah, this looks great. We take some old building and we try to fix it up and make it nice again. No, I want the building torn down to the ground, and I want something brand new put in, and I want everything new. Everything. If you're talking dental, you're talking health, I want it the state of the art. Because when you take these old buildings and you start tearing into them, oh, we had asbestos. Oh, we had this, we had that. Oh, all these additional costs, 2-3 times higher than what you have. But my question to you as the commissioners before you vote on this, what would it cost to do this building new? Everything, state of the art, brand new. Drop this old piece of junk to the ground. Have you looked at those numbers? Why do I think that's going to be a no? Because you have to give an option here. I want it all to be state-of-the-art, brand new. Forget this old building. I want brand new. It's going to last for years. People will insure it easy, won't have all those unknowns, and then we're good to go. Why take an old building and want to fix it up like the Portland building unless you have some emotional attachment to it? You know, Portlandia sitting out there on her little perch. You know, is there some emotional attachment to this piece of junk? Rip it to the ground, build something brand new. It'll last for years, up to seismic standards, up to electrical standards, plumbing, roof. Why wouldn't you go that direction? Because your budgets are upside down.
Thank you. All right, we'll go to the board for questions. Thank you. You guys are welcome to come back up. We'll start with Commissioner Moyer.
Yeah, I am curious of what the value of that property is right now and what the value of that property would be after investing $6 million.
Yes.
Thanks for the question, Commissioner Moyer. Dan Zalco, Facilities Division Director. We'll have to get back to you on that. At some point, we did assess the valuation of that property. It was quite a while ago, so we will provide that information and do an estimate for what it might be after the project.
Okay. I share some of Lightning's concerns about why are we retrofitting a fairly old building that I have gotten the pleasure to tour twice. Fantastic work is happening there. It is a physically cramped space in the halls, the size of the rooms. I mean, just overall, it is feels like a dated primary care facility. And so I do kind of wonder why the decision was to hold on to this property and invest $6 million versus look for maybe more updated clinic that may be for sale, or New construction is very expensive right now, so I in general get why that might not be the greatest approach, but I am concerned about putting a lot of money into something that will still feel cramped and too small. Anyone?
So is, just to make sure that I'm gathering the question, is the question more so around our decision to reinvest in this property over allocating new property? You know, I think we might have to get back to you on that as well, unless somebody here has that information. I don't know what was on the table at that time. I do want to recognize that we do have some infrastructure funding specifically from HRSA that is also time limited that needs to be utilized or we will lose it. So I can't say that that is the reason this decision was made, but I will say it was a quick understanding once that money became available to us that we needed to invest in Rockwood because of the larger issues that are present. We also purchased the property at a very low rate. I believe it was about $1 million, understanding that we would have to invest in the property.
Commissioner Moyer, I will add to what Debbie stated that about 4 years ago, when Care Oregon first informed us that they would like to sell the property to us, and if we weren't interested, they would likely sell it to another party. We did assess whether it made sense to stay at that location. Due to the positive qualities of its location, the size of the property, the size of the building, and some aspects of the building that are in fair condition, we did determine, and the fact that we also determined we would be able to negotiate an excellent acquisition price, far below market value. We did determine at that point that it made sense to acquire it and make some modest renovations to the property.
That's really helpful, thank you.
Yeah,
I appreciate it.
Thank you, Commissioner Singleton.
Thank you all. Like Commissioner Moyer, I've toured this property and know that the renovations are desperately needed. I'm curious how staff and patient input is going to be included in this design plan.
So in terms of staff input, right now we have staff input that is being leveraged around the transition plan. That is, for example, the health center manager brought a team out just to assess the new space and kind of determine what they need in that space. So that's really where the engagement is right now. When we get a little further to where we have design options, which we're not there yet, we need to get that contract, and some of the things around what that space looks like. That's when we can further involve our community health center board and do some work with the staff and around what this looks like for the community. So right now, we're really in that planning for the move space, and as we get that contract, we're going to have more flexibility to get patient input, staff input around what that looks like.
Thank you, and that's what I'm referring to is that design phase, so thank you. What is the communication plan for patients? This is any kind of health clinic closure is significant for people, so what's the communications plan?
Yes, thank you for that question. As we get that contract in place and have an understanding around what that timeline looks like, we'll start a pretty significant communication plan. We had a closure years ago that was Southeast Health Center, which included mailers, phone communication, surveys. We can leverage all of those things in which we did at that point that worked well for this project as well. We're waiting until we understand what the timeline for closure looks like. However, we might put a few things in the after visit summary. But at the point that we know what those dates are, that's when we're really going to start the communication plan. Anything we do before then that has any specifics regarding dates, we're a little nervous to do too early because we don't want to have to take that back.
Thank you. And I'm actually curious from you, and maybe you don't have this yet, but your staff will know the best way that their patients connect with them and hear from them. So are there particular communications mechanisms that you know work well that's important for them to know? Like if a mailer doesn't work, what are the options that work for the patients there?
Yeah, we got a shout out about our QR codes earlier today. So that is really one of those ways we try to ensure accessibility to different ways of feedback. In addition to that, one of the core things we've been doing for a few years, particularly as we were constructing the Fernhill Health Center, is really focus staff surveys to get information about each of the particular things. So we would likely do something like that where we go to an existing meeting and get specific feedback on what they know, how they think we can engage our clients.
Thank you. And that's the piece that I wanted to get at a little bit is you all know how it works in infrastructure projects, construction projects. We have this checkbox of things that we do for comms, and it might not always be what actually works for people. So I really appreciate that and hope that partnership moves forward. Are there any particular plans if there's any construction delays, which we know can happen? Is the plan for these alternative sites to be able to flex longer if needed?
Yes, and so I was a long-term manager of Rockwood before this happens, and whenever we have a construction project and I hear closure, I cringe. And we have wiggle room, given that we're moving into existing programs, which would be that third floor at East County. It'll be a challenge, because that's a lot of people in shared space. But we'll be able to stay there longer. Our biggest issue is going to be the pharmacy. The pharmacy requires the Board of Pharmacy approval for a move, and then at that point, we really have to be specific around those dates when we request that move. So we're quite honestly on pins and needles right now trying to figure out what those dates are, and we won't have that until construction. But that's where I think we might have some challenges. Everything else, there's some wiggle room, but the Board of Pharmacy, navigating that.
Thank you. And knowing that, I know that then you're planning for a plan B should construction, something wonky happen there.
Absolutely. And we do have a pharmacy at the East County Health Center as well. So there won't be a situation in which our clients don't have opportunities to get their prescriptions from the sites where they are. This is about managing volume.
And I will add.
Sorry, go ahead.
And I will add one more thing. As we were looking at sharing the space in the current East County building, we've been in close contact with our DCHS leadership and divisions to ensure we do that coordination, and we've really collaboratively worked with them to get some agreements around space sharing. So that will continue to happen if we need a little bit extra time.
Wonderful. Thank you all so much. I appreciate it.
Thank you, Commissioner. Commissioner Bram Edwards. Commissioner Jones-Dickson.
Yeah, great. Thank you, Chair, and thank you all for the presentation, and thank you for the tour a few months ago. It's extremely helpful as far as the context is concerned. I had the same exact questions that Commissioner Singleton asked around comms or communication to our residents in East Multnomah County. I'm beyond excited to see the $6.8 million investment as it pertains to our healthcare and creating space for our community members. And I'm all for expanding that footprint if we want to discuss that as a board, but that's not up for discussion right now. So again, thank you for the presentation. I'm supportive as far as moving forward with this work. Thank you.
Thank you, and I just want to thank again all of the teams at the county for all the work on this. I do think we have some really good learnings from the Southeast Health Center Clinic and the really long construction project that turned into as new things were discovered even as that was going on, and incorporating those into any possibilities with this project, as well as the construction of the Fernhill project that was so successful and is such a beautiful space. So I'm really Looking forward to having a refresh at this facility, the seismic resiliency, as well as some of the other things that we were able to add into this project as a result of the congressionally designated spending that we received for this. So just appreciate this, and I'm very supportive of this moving forward. Thank you. All right. Tasia, can we have a roll call vote?
Commissioner Moyer?
Aye.
Commissioner Singleton?
Yes?
Commissioner Brim Edwards? Yes. Commissioner Jones-Dixon?
Yes.
Chair Vega Peterson?
Yes, the resolution is adopted.
Thank you.
Thank you.
R2, first reading of ordinance moving the Office of Diversity and Equity, Chapter 25, into the Department of County Management, Chapter 7.
May I have a motion?
Second.
Commissioner Singleton moves, Commissioner Moyer seconds approval of R2. R2 was brought forward by Commissioner Moyer, so I will turn it over to her.
Thank you. R2 is an issue that got brought up during our budget process as it became clear that different departments were clearly at different places in implementing the WESP and our equity priorities. And I think it is really important that the commission who established the Office of Diversity and Equity reiterate our commitment to this work at a systemic level and in every department. In doing so, and based on decisions that have been made where the new director of the Office of Equity will report to our COO, I bring forward an ordinance that moves the office under the Chief Operating Officer in the Department of County Management. And I want to make this crystal clear. This is a commitment from the Board of County Commissioners that diversity, equity, and inclusion is a core operating principle of Multnomah County. It is not optional by department, and it needs to be integrated fully in the operations of Multnomah County. I bring this for a couple of reasons. One, in response to a concern that different departments were picking and choosing what to focus on, and I appreciate that at the beginning of initiatives, but this is no longer the beginning of an initiative, and it is time for consistency. It also creates significant HR concerns if you do not have consistency throughout an organization, but it is also a vote of confidence in our COO's commitment to this work and wanting him to have that direct role in making sure that as he operates the county as a whole, he is integrating and holding departments accountable for their participation and implementation of the WESP. I think it is important that we not view this work as any chair's, and it's not anything related to this chair, but any chair's pet project. This is not a fleeting effort that can come and go depending on who sits in that office. It is a commitment by the entire commission that needs to be institutionalized and operationalized with that same level of organization-wide commitment, which is why I'm bringing this forward for a vote and conversation. I do have a question related to the process, since, and this is for Jenny Madcore, it is my belief that this does not require 4 votes to pass because we are not moving a department, we are not combining a department or abolishing a department, which under section 6.20 of the administrative rules would require 4 or more commissioners to support that this is not a department, it is an office. And it is an office that is being moved from not in a department to a department. And so I'm seeking clarity.
So I can pull up the charter that you're referencing, Commissioner, and it's an excellent question. And if you give me a second, I can get the exact wording. So let me do that before I speak out of turn, so I have it precisely. And if we can move on to the next question, I'll jump back.
Sure. So, this really is an effort, one, to formalize current practice, since it is already been decided that our chief operating officer will supervise this position. It is also institutionalizing the Office of Diversity and Equity as a county-wide priority and not a side project of any particular chair. And it is to bring greater consistency and accountability to this work. All right.
Great. I believe we have some public testimony on this item.
Yes, we have Charles Johnson signed up.
Hey. So I was glad to see that, I don't know if I didn't pay close enough attention to tell, I guess on the APR, I could have told that this was introduced or being brought forth by Commissioner Moyer. So that makes me feel a little better. I think the only negative is just optic negative, I guess, especially when we look at the org chart, because now the idea of having some FTE and a person devoted to looking at how well we're doing D&E, or not DEI, anyway, but the main point is like, optically, it's somewhat nicer if you look at an arrangement of the county things and you see off to the side, here's this person / staff that is in theory empowered to help other departments have great levels of equity, diversity, and inclusion. And also, as we sometimes hear, to make sure that those people who are in those populations feel that they're being fully valued and able to do their best work. And on that line, that does make some sense, bringing this in under the COO. So I did want to point out that it's like, oh, we lose the optical plus of having this outlier not under another department supervisor. Once this all comes in, depending on how busy, crazy, chaotic things are in a year, it might be a super idea to have some of the union people or some of the different teams that represent, it's kind of awkward to call them marginalized communities within the workforce, but that's the truth. I mean, to have this linked with a progress report, I do think there is an annual thing that you come around to talk about ways you've improved that. But as we heard during the public comment session, there's still plenty of room to upgrade how we're making all workers feel valued and included, and minimizing disparities and awkwardness between managerial personnel and the people who are, and that's also something that really needs to come forth, printed out on paper for every constituent and concerned person to see, is the actual growth. How good are we moving people from, for lack of a better term, marginalized communities and minority populations? How well are they moving up from frontline entry-level positions into management and maybe being encouraged to be in your seats even? So thanks.
Thank you. Any other public testimony, Tasia?
Nope, that's it.
Okay, great. Jenny, did you have a response ready? Okay.
I do. So the question was about the number of votes that it would take to approve the move of ODE from the non-departmental unit in Chapter 25 over under DCM. And the commissioner was mentioning that ODE is an office, and that is correct. But it's also correct that ODE is an office within the non-departmental unit of Chapter 25. And so, although the language is a little bit odd, Chapter 25 is a department. It's just called a non-department. So we're moving a non-departmental function and unit over into the Department of DCM.
Yeah, I hear that, but I'm looking at the language too right now. And it says nothing about needing 4 votes to move an office from one department to another. It only says establish an administrative department, which this is not. Abolish any department, it is not abolishing a department. Combine 2 or more departments into one, which this is not, this is an office. Or separate departments that were previously combined. We're not changing any departments. We are moving an office from one department to another. So where does that fit into that?
So the change is to the non-departmental unit. So the non-departmental.
Right, but it doesn't say you can't change. It just says you can't create, abolish, combine 2 departments, or separate a department into 2. This action does not do any of those 4 things.
And I hear what you're saying, and I would say that what we're doing is separating the function of ODE from the non-departmental unit over into DCM.
Yeah, and that's not one of the actions listed under Section 4.
Section 6.204D says separate departments, so combined.
But I'm not creating a department of county equity.
We are not creating a brand-new function for Multnomah County. The ODE function has been in the non-departmental unit for many, many years. We're just, it's moving over into a new departmental function.
Right, but nowhere in this section does it say moving an office from one department to another department requires 4 votes. So that's why I don't understand your interpretation.
I hear your concern. My interpretation remains the same.
Okay.
Okay, so we'll go to the board for questions and comments. We have Chris here, Jenny's here. I'm here. I have some comments on this as well, so I'll turn it over to Shannon. I'm so sorry, Commissioner Singleton. I'm looking right at you.
That is quite all right. I do have a couple of questions. And I will say, as a former equity professional at the state, I reported directly to the chief executive because there was a need for that work to be done throughout everything that we did with our departments, and there was additional staffing within the administrative office that was around some of the components of equity. And so I see value to multiple different structures in how equity has been set up. My questions are, if this moves to the COO's office, how does that person relate to the board? Previously with the ODE, the way the structure was in non-D, I meet with all non-D directors. I don't meet with people who report to the COO. So what will my access be to this position if it moves to the COO? And I don't know, Chris, if you want to come down to speak to that or if you have thoughts. I should have started there.
Yeah, I should have sat closer. It's my fault. Okay, so the question was about the access.
Can you please state your name for the record?
Oh, yes, that's right. Christopher Neal, COO, for the record. I don't have any concerns about the access. I know you also have access to the deputy COOs and the directors, et cetera, all of which report to me through the COO's office. So I don't expect anything to change there whatsoever.
Great. My understanding is there are some concerns with even just the announcement of this person reporting to you amongst equity managers, as well as some folks in our employee resource groups. And I'm curious what, if any, process has been done to understand where their concerns might be and how those are being addressed, or if there needs to be some actual process done here to thoroughly engage people and help assuage some concerns that might be coming up with this shift.
I've done 2 things. First, I've met with all the equity managers. There was many that attended that day. There were probably 10 or 12, and we talked about this in advance. The second thing is I had multiple conversations with the Office of ODE as well about, probably 6 weeks before we did this. So I've had those conversations as well as an offsite with those in ODE. If anybody has any concerns or questions on how this transition will work, they can reach out to me directly, and I'll continue to engage.
So I think I will say I'm not in theory opposed to this. I'm a little concerned about the lack of engagement with the people who are impacted by this move and being able to actually hear from them. So I don't feel fulfilled in what I would need to know from the frontline staff who are impacted by this. So I'll leave that there for now.
Okay, thank you. I just wanted to share something. So I'm not supportive of this action today. It was the APR and the ordinance was created without consulting with me, my office, or with the COO. The intention that we had in moving you did not consult my office in putting together this ordinance.
I'm sorry, I object to the accuracy of that.
So we had a conversation about it after the APR was submitted for this.
I multiple times discussed this issue with you during the budget process. This should not have been a surprise.
So we weren't consulted in creating this ordinance. I will, like the language or the way that it was structured. Because if we had, what I would have said is that this isn't something that is necessary for the board action to take. The intention in keeping the Office of Diversity and Equity as part of a non-departmental unit, and it isn't a chair's pet project. All of the non-departmental offices are included in the Multnomah County Code in Chapter 25, so those are established in code and are part of the county structure. So not pet projects, but actually part of the work that the county does and part of our code. The intention in keeping it there is that I do believe, and I had many conversations with Joy Fowler about this, about having the alignment and having the connection to the chair's office as the chief executive of the county and keeping the work of ODE at that higher level, but also the intention that I had and that Chris had in better integrating the work of the Office of Diversity and Equity and the Chief Diversity and Equity Officer to the larger C-suite. And so this was the structure that we have in place with keeping it in NOND, but having the reporting structure go to the COO met both of those concerns. And this structure is actually what was intended. And that function is something I think especially in this time for me, keeping the Office of Diversity and Equity at the level it is really important instead of having it be a part of the Department of County Management. I think the other piece of this is this isn't an unusual structure. This is something that is exactly how the non-departmental Office of Emergency Management is structured, where it is a non-departmental unit, but that Chris Voss reports to the COO. So we use that kind of that structure as the way to really be able to make sure that we were having the intention of keeping it close to the chair's office, but also integrating it with the rest of the.
I understand what I proposed. And it is a change, but let me be crystal clear. If I thought this work was going well, I wouldn't have proposed this. This is a reflection of the reality that we are not consistent in our application of our policies related to diversity, equity, inclusion. Different departments have different levels of commitment to this process. I also had lots of conversations with Joy Fowler, and I'm going to be real clear. She was pretty frustrated with the lack of consistency and overall implementation, and she didn't feel that where her office was leading to the systemic implementation that she desired. So, Joy's not here. I'm not going to say I know what she would say right now because she's not here, but I will say I did not bring this forward because of a theoretical desire to rearrange an office. I brought it forward as and I tried not to go here, frankly, because I thought we could handle this without being open about it. We have a pretty significant issue with how our employees feel we are doing. They think that this board is performative in its approach to diversity, equity, inclusion. It is not implemented in a systemic way, and they don't feel like it's embedded in how the county operates. And I would say having an office in non-D that is not intimately connected to how decisions about how the county runs perpetuates that. And if it was so important to the chair, then I think the chair would have kept the direct report, but did not. So, I just have to say, we are not functioning well as a county on this issue, on a bunch of other issues. And this is a board-created office. And I think the board needs to be more involved, and I think we need to embed this into our chief operating officer's position. This is, I don't know, I guess you could look at an org chart and think it was less important. I certainly don't. I do not think offices that need to be core to the overall function of an organization should be in non-D as a rule. I think non-D is for intergovernmental relations and political policy work. It is not where the operations of the county is located. And I don't want to have this context void, or this conversation void of the context of we're actually not doing a very good job yet. We are not living up to our rhetoric, and I think that needs to change. And frankly, this is a vote of confidence in our COO's ability to affect change.
So a couple things that I wanted to respond to there. First of all, you said, if it was important to the chair, you would keep it as that. That is assigning motives to me, and I'm literally right here. The reason that we are having the move of having this position report to the COO is exactly because it needs to be better integrated into the work of the entire county, and the way that diversity, equity, inclusion, and all of the work that it encompasses is done throughout the county needs to be more consistent and needs to be better integrated in the workings of the C-suite at that level. That is exactly why we made the change that we did to have the reporting structure go to the COO. However, it is also something that I think as the chief executive of the county is really important to have line of sight into, continue to have this person and this office as a part of the team, as a part of my team meetings. So this is, I think this is the best of both worlds, both as an advisor to me as the chief executive officer, but also integrated better into that. So into the workings of the entire county, because we do have a lot of work to do. You and I are in agreement on that, and that is exactly why we did the move the way that we did this way. So I will move over to Commissioner Brim-Edwards.
Yeah, I appreciate Commissioner Moyer bringing this forward for board discussion. When I first got to the county, the whole concept of non-department was just like, that's what they're, like, what is that? What is a non-department? And I still, to me, I think it is still confusing just generally as a concept, because it makes them something other than integrated. It just seems other than integrated into the normal organizational structure of the county. And that's just somebody from the outside. The whole non-D concept was strange. So I have just some questions. Thank you. You're not a director, COO Neil, for being here. So human resources is already in the Department of County Management, correct?
Yes, ma'am.
And it sounds like from the conversation that already you supervise the director of that office, of the office.
Yes, ma'am.
This is a question maybe for the chair. So if they already supervise them, I'm curious about what the resistance is then. If it's already in the day-to-day sort of supervision responsibilities, it seems like it would make more organizational sense that they actually be part of that structure. So I'm just curious, and the second part of my question is, they're already there. Are you saying if they, that individual was reporting to the COO, that there's some rule or ordinance that they couldn't come to meetings or they couldn't advise you?
So to me, this is a way of making sure that the work of the Office of Diversity and Equity, the role of the Chief Diversity and Equity Officer is both an advisor and part of the chair's team, and also is integrated into the overall workings of the county. The way that it is currently written in our code is that the Chief Diversity and Equity Officer, the Equity Manager of OD, reports to the chair. This is in keeping, I think, with the spirit of that, the intention of that, the way that I see this role as an advisor to me, and in the importance of the work of this office being integrated across the C-suite and being able to be part of the work that Chris is doing as COO countywide. So again, this is, to me.
But there's no rule. I mean, my assumption is people at all levels of the county actively advise you because when they have expertise or that's part of their job responsibility. That's my assumption. I hope that's happening, that it's not just they don't report directly to you or they don't sit in the chair's office does not mean that they don't have access to provide you advice. And then this is maybe a question for Commissioner Singleton. You've just expressed a wanting to hear more from the individuals in the office. Given this is a first reading, I'm assuming that since there's not an emergency clause on this, correct? That a second reading could be scheduled in a way in which you would have an opportunity to have those conversations before there was a second reading?
I think that would actually be a question for Commissioner Moyer, because I don't know when the planned second reading is, but I would definitely not be comfortable moving this forward without actually hearing from the staff, because I know there's concerns, but I don't know what they are, and I want to understand what they are and how we can make sure that they're addressed for the staff. Sometimes the answer is no for staff, but not even knowing what the questions are feel hard.
I don't know. Do you want to speak to that, Commissioner Moyer?
Yeah, I mean, it is not scheduled yet for second reading because obviously it hasn't passed its first reading.
Yes, but your intentions and when you plan to have it on for a second.
Oh, yeah, I mean, I am perfectly happy to give any commissioner time to have those conversations. And I think, I do want to be clear that this is, in my mind, following what a decision that has been made for Chris to be the supervisor of the manager of this office. I think having a conversation about what does it mean to be non-D versus Department of County Management, I think is worth having. I'm perfectly fine. I think it has to be at least 2 weeks, but I don't think there's a
7 days is
the minimum, but it can be longer.
Correct, Commissioner, it could be as long as you wanted.
Okay, well, I can pledge to give you that time if that is helpful.
But as a matter of clarification, it has to pass the first reading before it would be scheduled for a second.
Yeah, I appreciate that. And again, I know that there's a piece in practice, but that's where I'm saying I want to know what is actually the concerns so that we can address them, you can address them, and people understand what the different structures will be. Because I don't think we need to keep coming back to this. Let's get it all and get it fixed and the structure situated and answer those questions before we move forward with that.
So I appreciate Commissioner Moyer giving the rest of the commission. I think today's discussion would be helpful. I'm going to support moving the first reading, and I'm going to be, I expect supportive of the second reading as well. Having been in many large institutions, both public and private, that has had the addition of a sort of office or department of diversity, equity, and inclusion, and most often the efforts and the initiatives are most successful when they're integrated into the structure and not a sort of a bolt-on. So I view this county commission has made a very significant investment in I would say, the professionalization of the county management through the establishment of the COO's office. And it doesn't make sense to me to have it doesn't make any sense for me to have things outside of that organizational structure not integrated. And my experience, at least on the county in the last 2 years, is that no matter where people are in the organization, if they have the expertise or the accountability and the responsibility for overseeing or managing or operating a particular project or initiative or body of work, that they are available not just to county commissioners, but also obviously directly with the chair and sort of planning the county's work. So I'm supportive because I think this will better integrate and allow, again, I think we're moving towards sort of a structure in which we have the county management, the day-to-day operations being run by the COO's office. So to me, this makes a lot of sense.
Commissioner Jones-Dickson.
Okay, thank you, Chair. Thank you, Commissioner Moyer, for bringing this forward. Again, how do you see the change impacting the work moving forward, like as far as improving the work that we're doing, and I'm struggling with the whole. Yeah.
Yeah,
if you could respond to that.
I think this is based off of numerous conversations that I've had, but it is my hope, again, to empower our COO to be able to have this work be directly connected to his work in guiding every department in how the county is doing business. I think that one of my biggest critiques of how we've done with implementing the WESP and other initiatives is that it has been off on its own, and it has not been driven by the chief operating officer, where we're in a room where that person, in this case Chris, has the ability to have worked with this director, is going back and forth on what is the shared vision of implementation, is then incorporating that person into the conversations with department heads, and it is clearly part of an overall vision of how Multnomah County operates. Because to me—
Can I respond to that?
Yeah, please.
So is that not happening now with you in the position? I mean, with the equity director, is that work not happening currently?
Yeah, the work happens, and whether I'm going to do the job either way. And the work is happening, depending on, you can ask specifics on that. But yes, I do collaborate. Yes, we do work together. So yes, we do have conversation.
Got it.
And the reporting—
What would be the difference? I guess what's between what's happening now and then what we're proposing here? What's the difference?
Yeah, I think it's an acknowledgement that Chris is taking that role, and I am thrilled about that.
But we acknowledged it through our strategic plan and through the tone that we set at the very beginning as a board, right? So
Yeah, so why I think this move is important to literally integrate it into county operations is we could have a chair in, 8 years who doesn't support diversity, equity, and inclusion. We could have a system where I have an issue with it being in non-D because I don't think non-D offices are integrated into the work of the county. And I think just having a report that could at any time change. I mean, that was a decision made by the chair, which means it could be a decision by a future chair to not do that and to not care about this office that reports to them. And to me, making a move to integrate it into the core functions of the county hopefully addresses the inconsistency, hopefully streamlines goals on paper into practice, and outlives any particular elected official. It is institutionalized versus, an office that sits out on its own and is valued depending on who sits in the chair's office. So to me, I view it very much as a deeper commitment to the organizational operation. And I view diversity, equity, and inclusion work as, contrary to current national climate, it's not a political issue. It's an operational commitment. So that's really, I really want to fully give that. And I worry that if the office continues to be non-D and it's only one direct report, how is that being fully integrated? How is that not tangential?
Chair, were you going to say something?
Yeah, I just was going to say, so the interim Chief Diversity and Equity Officer is currently reporting to the COO. That change has been made. The new hire for the permanent position will report to the COO. So that change in structure has already happened because it is important. It's a priority of mine to make sure that the work of this office, the work of that person, is integrated into the overall county work and to have better alignment and consistency across the organization. That is exactly what motivated the change in the first place. I go back to saying, I don't think that this action is needed. The Office of Diversity and Equity is in our code. It is a non-departmental office. Any change to that would require like if there was a chair who decided to get rid of it, that actually couldn't happen because it is currently in code. It would not be able to happen without board action. So I will just say, but again, to me as the chief executive of the county, it is important to have nexus with this office, and that is what keeping it in the non-departmental offices does for me.
What were you saying, Commissioner Moyer? Thank you, Chair.
Yeah, I would say you don't supervise department chairs, but I assume you have contact with department chairs. And let's say the next chair doesn't value the work. They could literally just not meet with them. And so I do think that we can't make decisions about governing the county that are solely specific to somebody in an office today. I think we need to think about how the county functions in perpetuity.
Got it. Appreciate that. And then County Attorney Badcourt, just a question. As far as the code, it was my understanding that there might be some concerns or some additional changes that would need to be made in order to when I was checked, as the code is written currently, is there any other, does that mess up anything else within our code or how we function, how the work is being done?
think I understand your question, Commissioner. I think if I can characterize the question as, would there be any other amendments that this board may choose to pursue to the ODE code as it's currently written? And if that's your question, then I think that this board may have other operational concerns about the language as it's currently written, and maybe to make it more robust or change it in different ways, prioritize different things. But that would be a discussion for the board, and is separate. What the commissioner has done here is move existing language from Chapter 25 and moved it right over under DCM. So it's a very clean, change, but it is possible, and I think maybe Commissioner Singleton is speaking to that a bit. There may be other changes, either in structure or in form to that office that this board may choose to pursue. And if they did, it would be through an amendment.
Got it. Okay, great. No further questions. Thank you.
Can I just follow up on that? I mean, when I'm looking at the language, although there's things that are struck and then new language added, it looks like, with the exception of where it reports, the rest of the language is just, like, so the language that's been struck out it's like the new language is just the same as the language that's been struck out.
That's correct, Commissioner Brehm-Edwards. It's basically, I would say, cut, copy.
So really the only functional change, and this is not to say the other language is fine, but really the only functional change is where the move of the office.
That's a fair way to characterize it.
Okay. And it doesn't mean that if other language would be updated, that like wherever it stayed, you could have made that, or if the language needed to be changed 6 months ago, that could have been proposed like outside of this, right?
That is correct.
Okay, so really the functional thrust of this just does one thing. It moves it. It's not changing any of the other pieces. And that's not to say that the other language is, the right language or anything else, but it's just functionally, this just does one thing.
I think what it does is it moves the function from one department to another department. So that's the one function. The second thing would be that it's adding a function to DCM, right? So it's removing it from one place and adding it to the other.
But in terms of this language, like it's providing strategic direction, it's managing contractors, providing regular updates to the board, coordinating programs. I mean, all that language is.
That is correct. The commissioner, what the commissioners put forward is it's just moving it over.
Okay, because it could be confusing, but like you just struck language, but then you just added the exact same language with the exception of the move.
That's correct. That's just the legislative process so that we can see what has changed in the code.
I guess that just then begs the question, as a separate matter from the move, is there other language, either that you, CEO O'Neill, or the chair, again, as a separate issue, wanted to change, or you're going to be proposing changes?
No other changes. I think the title might need to make sure that the title matches, but other than that, I'm not proposing any changes other than that.
I think that anytime the board takes the action to change our code, to update an ordinance, we should be kind of thorough and complete in the work that we do. And it has been, there have been things pointed out, like the current code doesn't have the most updated title for the director of this work. There are functions that are contained within ODE that are not reflected in code that could be done. So that is again, I think that those are things that that should be incorporated anytime we update our code or ordinances to try to make it as full as complete and matching the reality of the work that we do as possible. And that's not the case with what is being proposed right now.
Can I comment except for she's not actually proposing changing those sections of the code. This is what's confusing, is like, to me, just how it's structured, and this is not a criticism, but really it's just I mean, I don't know why we have all these other things struck and added, but really, there's one section that's being changed. And if we were changing, if the other sections were being changed, that would make sense.
Have substance.
But actually, it's just one section.
Well,
and I will just say, just as a general practice, we shouldn't have titles in our code because they change all the time. It's not best practice anyway. So I wouldn't necessarily be supportive of putting the current title in because it may be different in 2 years.
And I intentionally did not touch any other language. And I did that because I didn't want to confuse what the issue was that I was bringing forward. It doesn't mean that somebody else could not say, hey, let's update this. But I also, when I told Chris that I was working on this, specifically said I was not changing the language because I wanted to give him time to operationalize this the way that he sees fit, and that wasn't my intention. So my intention was not to get into the weeds of this, but one of the things that was my intention, and I was clear about this, is having the chief operating officer supervise this position is in fact contrary to the language of the code. And I brought that up because I think we are fast and loose as a county with how binding language of the code is or is not. And I am not okay with that. If we want to make changes, this is one I strongly support. I am really glad that our chief operating officer is institutionalizing this work. Our code specifically says that this position reports to the chair. Now, I understand the chair believes it's her authority to delegate that responsibility, but again, I don't like that we are not following the language of the code, and when we make changes, we need to change the code. And I do think that there is some real question about what is binding in the code and what is discretionary, and I don't want to operate in a gray zone. I want our county to treat county code as law because it is our law. And so if we are going to change things, which we should, every board should say, actually, I think this is the right way to do it. We need to institutionalize that in code. This was not an office created by the chair back in the day. This is an office created by the commission. And therefore, if you're going to make fundamental changes, the commission needs to weigh in on if those are the right changes or not.
So I just want to add, I think that the language, while you didn't change it, the language also doesn't reflect practice. The way I read this would tell me that every equity manager is reporting up through ODE, the way that it says, manage contracts and other diversity and equity staff, and that is not the structure. So I do think that this is worth taking some time to get this right and make any changes we need to existing language, fully respecting that you're coming from a different place on this. And I think there's a lot of agreement in where we want to go, but the language, even as it stands today, doesn't reflect what I've experienced in practice as a department director. So I will have some follow-up conversations. I may have some edits to this language. My question becomes, if we pass this today and then I have amendments at second reading, is that just a whole restart of everything?
So if it is passed today, then it goes on to a second reading. At the second reading, if there are any amendments, then those amendments would themselves come back for a second reading. Another option for the board today is if you didn't want to vote on the substance of it, or if someone wanted to make a motion to postpone indefinitely, then the whole thing would be postponed, and then the next time it's presented to the board, it could include any amendments or any changes that the person offering it opts to put in.
Thank you.
All right, any other? Okay. I think the last thing that I would say then is, Commissioner Moore, you made a statement like the chair believes that that I have the power to delegate the authority, but that is actually something that is in charter, that I am able to delegate my administrative powers but retain full responsibility for the acts of my subordinates. So I just wanted to make that very clear, that that is something that is included in the charter in terms of.
If it conflicts with the language in the code?
So the charter is our foundational document, which actually sets forth the duties of both the chair and the Board of County Commissioners. And the chair was just referencing Chapter 6 of the code that says that the chair is the chief personnel officer of the county and can delegate their functions, but remains ultimately responsible for those functions. So that's our charter, which is like our constitution. Our county code lays on top of that. And with respect to the particular code section we're talking about here, currently codified in Chapter 25, it says that the ODE director reports directly to the chair. The chair, in turn, in accordance with their authority under the charter, can delegate. And the chair has opted, in this case, to delegate to C.O. O'Neill the supervision of that office.
But was this portion of isn't this in the, so ODE was an ordinance?
That is correct.
So if we write an ordinance about how something should function, it's at the discretion of the chair to change it?
Well, the chair has the authority, as the board has their authority under the charter. That's our foundational issue. If there was a discrepancy between a code section and the charter would rule.
Okay.
And in this case, I don't see that there's a discrepancy. It's that the board had stated its policy direction through ordinance about the reporting structure, and then the chair, using their independent authority, has opted for a time. There was a direct report, which is direct and immediate, and then that was delegated to C.O. O'Neill.
Okay.
So just another parliamentary sort of just inquiry. And it goes back to Commissioner Moyer's question about the 4 votes. I take it that the actual action of changing the ordinance is the second reading, not the first reading, because the first reading is just advancing it to a second reading.
The first reading is to approve the ordinance to move to a second reading.
But is it actually to move it to the second reading, but the actual action of changing it is in the second reading?
The ordinance would not be adopted until after approval on a second reading.
Right, so that's the adoption vote.
That is correct.
Okay, so it doesn't seem like there are any other comments on this at this time. So Tasia, can we have a roll call vote?
Commissioner Moyer?
Aye.
Commissioner Singleton?
Yes.
Commissioner Brim Edwards?
Yes.
Commissioner Jones-Dixon?
I am going to yes, and I want to continue the conversation as far as the amendments and things like that. So I understand, yes.
Chair Bacon-Peterson?
No. The first reading of the ordinance is approved, and the second reading is scheduled for October. Well, so we had sent out to the board yesterday with the materials for next week that we were having it next week. So if we want to have do we need to say a date right now, Jenny?
Has the second reading already been noticed?
Not noticed, no, but we sent it out. We were holding space next week for this in case it passed.
Okay, as far as scheduling, the board can have a discussion on scheduling now, or scheduling can be decided by Commissioner Moyer.
Okay.
Can I propose that we move it to 3 weeks from today? Which would be the 23rd of October? Yeah, day after my birthday.
Yes, we can. So the first reading of the ordinance is approved, and the second reading is scheduled for October 23rd, 2025. Okay, so we are going to take a short recess, and we'll move to a board work session. I think we originally were going to have HSD present first, but we have, I think the sheriff has a hard stop at noon, so we'll have the sheriff come forward first. All right, so we'll reconvene in a few minutes. right, welcome back, everyone. We are now moving into our last agenda item for the day, which is a board work session to review the impacts of state, federal, and other funding changes to the county's FY26 budget. We will go ahead. We're running short on time, and we'll probably go over this morning, but I know that the sheriff has a hard stop. So we are going to hear from MCSO on an update on vacancy data and other responses to the board.
So just to level set, we had provided responses to questions that were asked in our last meeting here. And so we wanted to take an opportunity first to ask if there were additional questions around, there was questions around demographics. We talked about 624 clients assigned to Close Street at this time, 215% increase. And there were questions around what does success or the outcomes look like, and that's provided in that document, as well as what we had provided as our options to manage this reduction. And then there is a question on here around the vacancies around MCSO, and we can walk through that chart with you if that would make the most sense to start, since that's the first question that you have.
I think I just want to say my question wasn't specifically about vacancies. It was about trend and spending trends. So I'd love just to still have some follow-up on if we're seeing the spending trend similar to what you've had in past years. I know it's hard. I know it's all projection. I get that, but understanding that trend would help me know.
Yeah, that makes sense. I mean, I can, in maybe a couple weeks, we can speak intelligently to where we are right now in the fiscal year, just because at the very beginning when we do our current year estimate, yeah, the methodology is similar, but really the trend line is not super informative to us. So like that confidence interval gets a lot narrower the further we get into the year. But I'm happy to have a discussion about like in concept how we track that and how we end up deviating that or not from the end of the year. All that stuff's helpful. The reason we had highlighted specifically these categories, and I apologize if this didn't come through too. The reason I had highlighted those categories, the vacancy rate among those 5 classifications, is just when we did our current year projections throughout fiscal 25, all of these vacancies were present for most or all of the year. And so that vacancy savings that you can aggregate out of that chart, which is well over a couple $1 million, that vacancy savings I know is gone. So when I am trying to do a CYE for this year, at minimum I can back that out. As to where that puts us at the end of the year, I don't want to speak confidently to that, but that's kind of our main point here.
Thank you. That's really helpful. I just want to say that I totally agree. I think that, and there's larger conversations about pretrial services and where it belongs. Sheriff, if you're open to it, I'd love to have somebody on your team to work with. I'd like us to find a nuanced solution here, and I'd love to look at, my understanding is it would take about a year to look at what a transfer of pretrial services could be. There's some costs that are unclear to me that might be needed in other departments or offices. And I know we're not making a decision today, so I know that there will be it may be that you are needing to tap into contingency for this year, and there's a partial one-time only ask for next year, but I just want us to, I'd like us to spend some time. And so if I can work with somebody on your team to really look at that opportunity, I'd love to do that before we get to a vote here as a board. I want folks, you're serving a lot of folks, and again, I don't think that it's the right place. I know that's not best practice, but I also want to make sure that we've got a solution for this over 600 people that seems to be trending up in the number of referrals you're getting as well.
Absolutely, thank you. And I believe on Tuesday there'll be time to dive in a little bit more to pretrial services as a whole.
Yeah, we've invited some folks in here. Sarah Mullen from Lipstick will be here. I think we were going to have some folks from the courts here so we can have a more robust conversation about pretrial and looking at that. Other questions for the sheriff?
Sorry. When the reductions came down, you proposed that, as an independently elected official, like, that manages your budget. So once the commission adopts a budget, it's my understanding that, like, you have the, like, authority as the sheriff to implement the program and do your work with the budget that's been approved. Then with the reductions, explain why you, there's an increment in this year's budget that was approved of funds that went into contingency to expand or be able to open another dorm. When this reduction came down, your initial proposal was not to, wasn't to move Close Street, but to use that contingency fund. Explain, just in the context of the last several years with the vacancies and just now getting the HR headcount, why you're proposing that versus just taking it out of what may be underspend right now.
So to back up a little bit, there were approximately 3 years where we were advocating for some pretty significant investments in human resources to start tackling the vacancy gap that was continuing to grow at the sheriff's office. There were times where we were heavily focused on corrections deputies and law enforcement deputy sheriffs, and that largely did not include ensuring our proper staffing levels for civilian roles. So in December of last year, we were successful and we were grateful for that investment into HR. With those new positions, we needed to recruit and put people into those roles, and that occurred in about April-ish. During that time, we were evaluating from the very beginning when someone applies for a position all the way to the day that we're hiring them, our process, and made a significant amount of process improvements to ensure that when we had individuals seated into these new positions, that we were putting, that we were starting a new streamlined, more efficient process to get the right people for this organization in a reasonable amount of time. We also did a significant amount of work with Central HR in helping us develop those processes. Now that we are there, in the chart you will see that there has been significantly reductions in vacancy rates over our civilian and our law enforcement positions. And now we are focusing in with a new recruiting strategy and marketing strategy for our corrections deputies that will be coming with another recruiting event in later this fall, winter. So we recognize that we returned underspent this last fiscal year, but also the bottom line is that we have a $1.4 million reduction. And we cannot continue to just do business as usual and not start working toward what do I need to reduce? I have to reduce a program. Waiting to see what will happen, I don't feel is the responsible decision given the continued concerns and budget outlook for continued reductions to follow, whether that's through our regular process or through federal funding that impacts the entire county. When you're looking at mandated versus non-mandated programs, as well as the cost of programs, this service, Close Street, is a non-mandated and highly expensive program, and it's not yielding the results that we would like to see and the support for the clients, given particularly that there are 624 people on the caseload and it's continued to rise. When you have that many people that you're trying to manage, you're not providing the services that we potentially were providing many years ago when it was 150, 180 client base. And so we asked, so we asked for the contingency funds to help us manage through a thoughtful transition. This is a large-scale project. We were already in the middle of an assessment. We have the final report that I received today on how to identify the best process moving forward that is not MCSO doing Close Street.
So if you use the contingency, there would be a longer runway to have this conversation about the best way for pretrial supervision, close street supervision to happen. Is that?
Correct.
So if you currently used, and that was to be adding on, but that's assuming that you'd have even the staff to add, to add beds beyond just staffing what you currently have. Do you anticipate that if what now would be the going right into the heart of the program offer and taking some of that money and using it to cover the deficit, that you would have be closing bookings more often, or potentially get into like emergency releases? I noticed you're kind of been bouncing around. Obviously, we had I don't know, a couple months ago or earlier last winter, some yellow warnings that there were going to be emergency releases. Speak about just like the general operational impact.
So we're continuing to monitor, as you know, daily our population. There are times where it's trended upward that is not historically when it has trended upward. The challenge right now and the focus is hiring corrections deputies, and we are doing that. Again, we had to completely overhaul the entire process and make it work and be functional for the entire organization. Now our focus and the capacity, there's additional capacity now that we're hired up in different areas for backgrounders, for folks at the front end of the process. So as I talked about before, recognizing that opening another dorm today would be extremely challenging. It could potentially happen on a emergency basis, just as we did over the inclement weather, but to have enough staff to open that full time, I recognize that that is probably not a possibility until further into the fiscal year.
So until you get more corrections deputy hired.
And trained.
This is a long pipeline, that those will be just to cover the current staffing versus expanding jail bed capacity, which is what the contingency funds were for.
Correct. It also gives us the availability, again, on an emergency situation to swing that dorm open as we had to, and we were able to mitigate that over about a two-week period. There are several options that we put in place as we see our population increase, and we'll continue, as we have in the past, to keep everyone informed on how we're managing that.
So I had a question about the 1.36 million increase in your budget for the Troutdale contract. So that is something that is in addition to, that wasn't a part of our, the FY26 budget that the board passed for your office because of the timing of the contract. So it's something that's going to be an addition as part of this. Can you talk about the cost? So like what exactly you are going to need of that 1.36 million for the cost of an additional personnel to fulfill that contract?
So I guess there's kind of full-time personnel, and then there's also ancillary unaccounted for costs of the contract that are not captured in FTE. So I'll take the FTE first. So the contract historically has a direct patrol function, and then it has supportive functions in the form of investigations, detectives, as well as records. Investigations and records are shared across the agency, but a significant, like on the order of 30 to 40% for those different units, a significant portion of that workload is consumed by Troutdale. And so when we went through this renegotiation, we looked at the FTE that were in the original IGA, and it just doesn't make any sense when you look at the workload that Troutdale actually consumes. So in going through that negotiation, we asked them to expand those FTE. And you can see that in the delta between the two IGAs, even though it's an interim IGA. We added a detective position, we had multiple records positions, There are also positions that dropped out, but the revenue for those dropped out as well. Like there was an administrative position in the previous IGA that went away. The dollars for that went away as well. The total of the added FTE, forget it off the top of my head, but it's on the order of something like $800,000. The balance of that for us goes to overtime. Again, overtime not in the discretionary, I need to stay after my shift to do paperwork, sort of maybe stereotypical thinking of what overtime is, but overtime in terms of just structure. Deputy A is on vacation, so he or she needs to be covered by Deputy B. We still need to pay Deputy A because we've given them this leave, so now we're paying for both Deputy A's leave and Deputy B's working hours, right? That's where our overtime is generated. The contract did not account for anywhere in the ballpark of sufficient costing for that the first time around. We're able to add some money to that in the contract, which you can see in the IGA. It is still wholly insufficient for recouping those costs. The only way, frankly, that we've been able to make those costs work, like in the last year, for instance, is because we had a litany of law enforcement vacancies, both on the sworn side and on the record side. You can see that those have now been largely erased, thanks to your investment, frankly, in our human resources, which is awesome. But the cost savings there has commensurately disappeared.
Okay, thank you. Oh, well, Commissioner Moyer has a question, and then we'll go back to you.
I'm curious, because I think decisions by other entities influence your workload and demands. And, you know, I am aware that our presiding judge has made a few decisions that have impacted the use of jail. Correct me if I'm characterizing this wrong, but due to a real issue with individuals showing up to court dates, we are holding more people, which obviously has an impact on our budget. It's also my understanding that we are the only county where the sheriff's office is funding pretrial supervision that is being utilized. I assume it's judges who make a determination if somebody is participating in that versus other pretrial options. And so what conversations have you had with, it's still Judge Greenlick, correct? Judge Greenlick and the Oregon Judicial Department around this relationship of policy decisions they are making and its impact on your ability to operate the jail, not be forced to release. I certainly, in my district, hear a lot about not wanting to have jail release and a desire to increase our capacity. So I'm very nervous about anything that would result in a reduction of our bed capacity, and also some of the decisions that our judicial partners are making where they are not footing the bill. And so I'm trying to wrap my head around these policy options. I am nervous about dropping closed street without a ramp. I like the intentionality of that because these are real people, and I think doing things well sometimes takes a little bit of time. But I'm also looking at next year, and that hole continues into next year, as there may be other holes. I expect the state will have to rebalance, and that will not lead to good things for our funding, as we may have to have another budget reduction year. And so I'm trying to think through, from your perspective, your expertise, as you look to the future, what are your priorities? What are the things that you wish you could do but feel like are not sustainable? And you know, if there was access to the contingency dollars, where would that put you? You know, how does that change what next year looks like? Or how you would approach if there was a surge in jail bookings or your ability to respond?
So we continually talk with our partners about jail capacity, impacts, what can we do but differently and better. This is a large project that we were just started. There will be opportunities for everyone to come to the table and make sure that we're making the most thoughtful decisions moving forward. With respect to capacity, again, I'm continually monitoring and managing that as best that we can, given the uncertainty of what's happening in our community. And in the future, sure, there's all kinds of more supportive services through our correction settings that we would like to be doing, because when people are with us, that may be an opportunity of clarity. It may be an opportunity to connect them with a resource or service. I saw a perfect example of that when I went to do a dedication of our Inverness Library of 3 adults in custody that were really sad that this person was retiring, and they were getting so much out of the programs and services that she was providing and career paths. And one mentioned the joy that he felt when he walked out of that room. That's what I want our correction settings to look like. Focusing on the places where we can make a true impact is where I want to focus those resources, if there are additional resources at some point, building out those types of programs. As we navigate transitioning and stepping out of pretrial work, not the sheriff's office not doing this work and stepping out of that, it does need to be a thoughtful process, and that is where contingency funds is beneficial. We returned underspent, which we asked for the next year, but the reality is the state provided an adequate amount of funding for the amount of 1145 adults in our custody. We were able to right-size that and do all of that work along with DCJ this last year. So we are at the point where we have to reduce something, because it's not the state's burden to maintain additional jail beds outside of what they are providing us today, which is also in alignment with the amount of money it costs per day for an adult in custody.
And I would add, Commissioner, I think that's some of where my thinking was going in my conversations about pretrial is this is work that doesn't necessarily have to live there, and it may be that that reduction, if it comes through as a one-time only request for next year so that there's the appropriate amount of time, then they would still have, they would have that reduction of that ongoing program.
One more. Then I need to meet Carla.
Any more questions?
This is just, are there any other cities in Multnomah County that have that they don't pay full cost recovery for services provided?
For law enforcement specifically?
Yeah, I mean, so the materials we got said that the new agreement is not full cost recovery, or it's subsidized, or am I reading that?
For Troutdale? For Troutdale, no, it absolutely is not. It is not full cost recovery. Troutdale has indicated over the course of our previous negotiations this year that they want to move back towards a municipal police department for a variety of reasons. So we agreed to a 3-year interim IGA with them to give them the opportunity to stand that up, both budgetarily and operationally, knowing that we would not be receiving full cost recovery during that interim period. We were pretty transparent about that in our briefings in the spring.
Yeah, I guess I'm just saying, like, services that get provided elsewhere, are they subsidized, or do you have other IGAs with the other cities, or are they
So it's a yes and no to different degrees. So like we have another IGA with the city of Fairview, right? That was negotiated subsequent to the original IGA with Troutdale. There are some discrepancies there that get us closer to full cost recovery. Like for instance, the way that we handle PERS within those contracts is preferable for the county with the Fairview contract. We still are not at full cost recovery for Fairview, and we will have that in mind going into that negotiation.
Yeah, this is just a general comment. I think we're in a time in which there's going to be reduced state and federal resources that focusing on like the county's core services, whether it's the county or the DA's office or in the sheriff's office, just really keeping like what are the core responsibilities, and you know, those getting the first sort of the first tranche of funding, so the priorities of funding. So that from just my perspective, just long term, that's going to be something I'm going to be interested in.
Can we just track other questions and follow up?
Okay. Yeah, absolutely. So you can go. John, thank you so much. Sheriff, thank you so much. You're welcome to go. We'll move on. And you can go. The only comment, just to, for your point, Commissioner.
I'm sorry.
Yeah, you guys can.
Vince didn't get a chance to ask any questions. I'm saying, can the sheriff go? Can he hang out for a second? If
John.
there's any more questions?
Yes.
Yeah.
I know where to find you.
No, yeah. Okay, Commissioner.
Yeah, no, it's just more or less a comment. Luckily, I spoke to Sarah Mullen and Sarah from your staff yesterday around the pretrial work that's been happening over this last year. So I'm very much looking forward to that presentation that's coming here soon and the report out that they sent to our staff last week. I think that's going to help us collectively as a board as far as how we navigate and decisions that we have to make moving forward. And I was just going to say thank you to the sheriff for focusing on how we're just the level of care that we're providing and opportunities that we're providing internally within our carceral system here within the county. So that's it. Thank you.
Thank you. Yeah, well, we can continue this conversation on Tuesdays when we dig in a little bit more to pretrial. The only thing I was going to say about the questions around the law enforcement and the contracts that we have is that one of the interesting things is that, by state law, if a municipality doesn't have its own law enforcement agency, then the county then becomes responsible for providing response to that city. And that is a factor, obviously, in so if Troutdale and Fairview didn't have their own municipal law enforcement, the sheriff's office would still in some way be responsible for responding to calls in those areas. And that's also a factor in, how we look at these contracts. And there's a lot there too, but I just wanted to bring that up because that's always a consideration in thinking about this.
I would just say that but the county and the sheriff could decide the level of service that's provided. I just know from work in Washington County, if you're unincorporated and you don't have a municipal service and it relies on the sheriff, you actually are in an enhanced sheriff patrol district. So it's like a property tax levy where while the service is provided by the county versus a municipal police force, the residents who get that additional coverage, which is quite good, is paid for by the residents, and it doesn't seem like that's the case here. Yeah. Or do we have an enhanced sheriff patrol? I mean, maybe district or?
Not that I'm aware of.
Okay.
Yeah, the cities at this point are paying for it. Yeah. Okay. All right. Any other questions for John? All right. Thank you so much.
Thanks.
Okay, we'll bring up HSD for follow-up. Thank you, Sheriff's Office. And all right, so thank you, Anna Antoinette. In the interest of time, I'm going to just open it up to see if folks have any specific questions that they wanted or were there specific points that you wanted to bring up today as follow-up. We didn't have a lot of time for questions before, so if there were some major things that you wanted to make sure get shared, I think this is a good time to do it.
We were going to follow up on a few questions verbally. We did share some written responses last night, but we have some that we were going to handle verbally. But if you all want to ask more questions first, it's kind of up to you. We can launch into our responses if that is a starting point, if that would be helpful. For the record, sorry, Anna Plum, she, her pronouns, Interim Director of the Homeless Services Department.
I'm sorry, I want to jump in because I want the data follow-up you provided doesn't respond to my questions. It was specifically about the sustained households, and looking at the larger doesn't get me the information I actually need. So, you know, again, don't have to answer this today, but I really think the data about the sustained households is something that we need to understand, because I am still unclear if we are providing essentially vouchers because people are poor and they can't afford their rent, but that's not the way our subsidies are structured. And so looking at everybody who has been housed is not the same as looking at just those 600 sustained households.
Yeah, so we can follow up with the length of rent assistance just for the sustained households. Having that data on who is sustained, that's new to us this year, right? That's a new way we've been able to look at households. We can get you that specific detail. For that first question, we gave you average length of rent assistance by program, but we can then add on that nuance of within those programs, the sustaining length of assistance is X. That being said, this is the average number of days of assistance, which is a sense of how long we are sustaining people, because that is the length of time that they are in the program.
But I would disagree, because PSH, it's permanent supportive housing, we're supposed to have an ongoing subsidy, and so lumping that group in isn't necessarily where my interest lies, and the demographics lie, and all those other components. So that's why I'm asking for the sustained households disaggregated.
Are you also, and we can see here, and sorry folks that are, just see the document, we do have, for example, rapid rehousing, average length of subsidy was 188 days. That's about 6 months. That makes sense for what we would expect for rapid rehousing. You see a much longer length of stay for PSH, 467 days. And that has to do with we're bringing on new PSH all the time, so that's gonna be a shorter length of sustaining time. To your point, we can follow up and pull out the PSH at the demographics if you just wanna see the rapid rehousing length and the rapid rehousing demographics, we can pull that out for you.
So let me ask this way then. In your PH housing only in here, are they vouchers?
I muted myself instead of unmuting myself. I would have to look at what that specific one is defined as.
Okay, so this is what I wouldn't expect, rapid rehousing we know is up to 2 years, so I wouldn't expect sustained households to be in the rapid rehousing category, and your data here reflects that. Where I'm getting at is the permanent housing folks, where they're not in a voucher program, but we may be providing more than rapid rehousing placement, which I see here, but because it's all lumped together, I don't necessarily know that then the demographics and some of the other pieces are that piece is disaggregated.
Okay.
Does that make sense? I can also, maybe we can do a chat with your data folks so we can dig into it.
We can include the data folks in, and I would just say that I think the only thing about, we want to be really clear about what I mean by sustained. So you would see rapid rehousing folks sustained for a period of time. And this is because we want to be able to pull apart in a year, but yes, we will follow up who we newly placed. But if we just report on new placements, we're not talking about folks who are placed previously but are still getting some assistance. So you will see some rapid rehousing for folks who are placed later in that fiscal year, but show up in the next fiscal year because their assistance hasn't ended. So that's just that's the nuance. But you would expect it to be very different timelines. And to your point of, do we consider housing only to be a longer term program or not? And what does that mean for us? I think that's the conversation you're wanting to have, and we can follow up with more nuance there.
Thank you.
Anything else you were going to report out on?
Yeah, so there were a couple questions around income, and I'll just start there, and they were also from Commissioner Singleton. I want to be clear, and then I'll go into some other ones from Commissioner Moyer. We have unreliable data on income across the board. It depends on the program. This is challenging because a lot of the folks we serve have unstable incomes or fluctuating income or informal income, and so it's not necessarily really accurately reported. That is different depending on the program. The programs we're talking about in the rebalance are rapid rehousing, and that's more the case for rapid rehousing as our income data isn't excellent. When you get down to something like the RLRA program, Home Forward does collect income level at program entry, but they're not recertifying that except for every 3 years. So if somebody enters with income at entry, they don't have to recertify. If they enter with no income and then gain income, they are expected to report that because that impacts their rent level as they move forward in an RLRA program. So that is a longer conversation. I totally understand the concept of what are people's incomes? Is their income calibrated to that placement that they're in, or can we figure out how to make sure people's income level matches like the type of housing? Great conversations that I think we need a little more time to dive into and think about how we use our data and how else we might answer that question. So I just wanted to circle back on that. I understand it. We can't answer it today, but we understand why we need to learn more there.
Thank you. I want to be clear. I think we place people, again, having done the work, I've definitely placed people in apartments that they couldn't afford maybe for the long term while we were waiting for a subsidy to then attach to them as a tenant-based voucher. Again, I'm specifically talking about the sustained because, and let me just play it out all the way. I'm hearing about vacancies at a 60 and 80% AMI level in our affordable housing. Where I would like to understand is, do we have households that we're paying market rate rent assistance that we could actually get into these rent regulated units and they could afford their rent without subsidy, or they could afford their rent with a smaller subsidy than what we're paying in market. And so that's, I'm trying, and I, not at a household level of matching, but just so it's kind of clear to folks where I'm going with that, that's one of the things I'm trying to help us figure out.
And that's related to a question that Commissioner Moyer asked around like how much of what we're paying is at market rate. Again, I can't tell you that data right this minute. It's not something we would reliably necessarily have on a global basis, but the conversation of not only are we matching folks to the right assistance, but is their housing placement something that makes sense? Are there affordable units we're not accessing that would be better for some folks? Really good conversation. I know that conversation is happening across the river at the city as well. And I think as a part of our larger system-wide planning for 27, we need to combine those conversations so that we're using the best resource for the best person. Sorry, I need to look over here as well. Yeah, absolutely. That's part of this larger, how do we build a complementary system conversation. If there are vacant affordable units that we're not using, we need to be using those, and we need to make sure that we're putting folks in there that can best benefit from those. So absolutely understand the bent of the conversation. We need a little more time to figure out who needs to be in those rooms for the conversations and how we move it forward. Looking at my notes, one second. The other thing I wanted to highlight were a couple there was a question about our planning for transitioning folks, was again, very, very similar. When we came up with the estimate of 600 folks that will need to be sustained, given our timelines, that was based on the number of placements that we had that we think will need about 6 months more assistance into this fiscal year. But when we get down to sort of actual more detailed planning, we do talk to providers and say, okay, you have a caseload of X number of people in this particular program. Can you let us know how many more months of assistance each of those households is going to need? And we do that more detailed planning. So that is, again, a part of your conversation around like, what does it mean to sustain folks? Are we sustaining folks in a program that is unsustainable? Sorry, that's a very terrible use of words, but I hear what you're saying, right? We need to figure that out, and I appreciate your focus on that because it does help us make sure we're being effective with our resources. We also had a question around making sure we're not across all of our departments cutting the same community-based provider, which I think is a really excellent call out, and I just wanted to be able to respond to that since we weren't able to last week. We are totally aware of that. I know, for example, we have one community provider that we work with, but the health department and DCJ also work with that provider, and they're already experiencing cuts. We do a really good job of communicating across departments when we have that kind of impact, usually because we're saying, hey, can anyone else help out here? Like, do we have any way to avoid this cut? But I think that's an absolutely really important thing that we continue doing, particularly when we know we share common providers across that homeless services, mental health, community justice continuum. So that is something we're keeping an eye on, and we will continue to keep an eye on, so we're not unduly burdening one provider in our suite of providers as we cut programs. And then Commissioner Abram Edwards, you sort of had a couple questions around planning for next year, our strategies, how we align all of that. We spoke to that briefly, but I want to circle back on that. We do have Jillian from HRS in the room if we need to call her up as well, but she and I talked to make sure we're on the same page as we respond to this particular question. And the question was around sort of how are we going to pull in those plans as we look into 27, knowing that we're going to have reduced resources. So I want to say a couple things, then I imagine we might have a larger conversation about that particular topic. So When it comes to the homelessness response system and the homelessness response action plan, I think one thing to call out is the second iteration is more focused, it's better organized. We're also working really hard when we get to those indicators to make sure those indicators align with the resources that we have. We want to make sure we're setting goals that are rationalized to the funding that we have so that we can be aspirational but also realistic about what we can do and the levers we can pull to reduce homelessness in the region. So we definitely are looking at the implications of costs as we set those goals. The way that I think we solve that is that more balanced system so that we are funding shelter and housing and employment services and eviction prevention, and we're doing a balance of things that we think will help us get people into housing and stay there and avoid losing their housing in the first place. So we're doing a couple things, and when we lean on the sheltering strategy question specifically, what are we doing with the community sheltering?
Before you move the community sheltering strategy, and I don't have to have this before we have our vote on the rebalance, but I really would like to better understand what those changes are, because it was just like a bullet point, not even a complete sentence, like this may be all impacted by the, HRAP 2.0, and I don't know what it is that is being planned or that we potentially might be agreeing upon in terms of a policy shift. So it'd be great to get at least an executive summary of what those changes are, like in writing, so we could just see like we're going, from to. And I'm not opposed to change. I just want to know like where the shift is happening so that, when we get down the road next year, it's not, well, we had that line that we said we were moving to this 2.0, and this was what was in it, and it may not be something that either myself or other commissioners supported. So I'd appreciate a better understanding what exactly the shifts are from what we're doing now to what we're planning on doing, and what our theory of action is, and then what the expected outcome might be.
I'm going to answer that with two things. Number one, we can absolutely work together with HRS to meet with you and kind of walk through the differences between the two plans. In terms of our budgeting and our budget plan, we actually start tomorrow to plan for 27. We have an all-day retreat tomorrow to start our 27 budget process, even though we're still in this one. And that is going to be built around what are our core services, what's the appropriate balance. So I can't answer that yet because we're walking through that process now, and it will depend on some things that are going to happen over the next few weeks to months. We will absolutely keep you updated as we land on what we think our services are and whether that shifts some major items. So there's a kind of two parallel processes happening.
I think it's a good point that, and I don't know, Chair, if you would plan to have an HRS kind of briefing come, but I do think because we're having these conversations at the SOC, and absolutely, of course, it impacts Homeless Services Department, but it's really not your department that's running that process, but a briefing or a work session or something so you all can see what is being proposed and what those discussions have been. I will say, there's a lot of alignment in the conversation with what we were proposing as SHS metrics. And so, yes, doing the crosswalk is important, but just to acknowledge that there hasn't really been that briefing moment for this board.
So that's good to hear. And you can't tell that by the sort of one bullet point that just like, there's this new thing coming. It's like,
Yeah, so we have already on the snapshot is posted for November 18th. The entire briefing that day is dedicated to HRAP 2.0. Okay.
Because just say, unrelated to the budget, but my expectation is, we're now tracking inflow and outflow, and if, I'm going to expect to hear like what our theory of action is if we're changing it, or if we're not making net progress, what needs to change.
Any other questions for HSD? Because I know
she was going to finish the community sheltering strategy, which I wanted to hear. Sorry, but
so the second question was what's happening with the community sheltering strategy. And so two things I wanted to call out. We are currently working on an analysis of our different shelter types, costs, and outcomes that we hope to present to elected officials in December that will help us as we go into decision-making for the 27 budget. We are also working on a plan to achieve that original 1,000-unit goal within existing resources. We hope to talk to you all about that very, very soon. I think that will depend somewhat on what happens with this final state rebalance, but we are hopeful that we'll be able to get there, and we hope to get you all details on that very, very, very soon.
So we'd be hitting the 1,000 beds by, from the county by December 31st?
That is the hope, yeah.
Okay. That's welcome news because we were 300 down, I think, a month ago.
We have all but 185 funded. Well, all but 150-something funded. If we move forward with pulling back on ECHRC, the delta that we don't have funded is 185. There are a few construction projects that might push into early next fiscal year of a few units, but other than that, we feel pretty confident. Yeah.
Great, thank you so much. I want to thank you guys for the questions, and we'll have more opportunity for conversation next Tuesday. DCHS, you have been waiting so patiently. And then I think DCJ had to take off anyway because we finished public safety, so we'll have DCHS and then we'll go ahead and break. And by break, I mean adjourn. All right, good afternoon.
Good afternoon, Chair and Commissioners. I know it's we are going to be very quick, hopefully. I just wanted to say my name is Mohammed.
Oh, just hit the button. It just went off.
Sorry. Oh, it was on. Okay. Mohammed Bader, I use he, him pronouns. I'm DCHS Director, and we're here today to make sure that we follow up with you on the rebalance. There were questions that you asked us. We submitted those in writing. So hopefully, if you want us to go over them, we're happy to go over them. If not, if you have questions on them, we're happy to answer that. I also have the rest of the team with me here. I have, and then we can introduce yourselves quickly. I mean, we're hoping to do a follow-up actually today on the concerns that was brought up about the licensing. And so I was going to have Alexis go over that. But if you do have any questions, or if you want me to go over the questions we sent to you, I know there's some questions from Commissioner Singleton and also from at least like 3 of you. So we're happy to go over that too if you want. So go ahead, Alexis.
Alexis Alberti, she/her Division Director, Intellectual and Developmental Disabilities. Are we just doing intros now, or am I jumping in?
Yeah, I'll do intros here just so that they know he's quickly here.
Hi, my name is Jacob Mestman. I use he and him pronouns. I work as a Quality and Business Services Manager, and today I'm kind of 2 roles. I'm sitting in for Director Jimenez, and I'm also representing the budget.
And good afternoon. My name is Marina Kalina, and I'm a Senior Manager for Community Services Programs at the Aging, Disability and Veteran Services Division. And I am here to answer your questions about the programs, if you had some.
Great.
So let me know whether you want me to recap the questions you have. You're good with that? If not, I'll turn it to Alexis.
Well, I know we're short on time, but we talked briefly at our rebalance session about the licensing centralization, and both for our adult care home program and for our children's certified program going back to the state. And so I wanted to just talk a little bit about what our primary concerns are and what our emphasis and strategies are on to reduce risk both for our community and for our clients and employees. And so, as you all know, we have 5 positions that are being centralized. We are working with the Office of Developmental Disabilities to talk about employee benefits, wages, and transfer opportunities. We do know that there might be a difference in benefits and health, which the county will be supporting to pick up so that employees remain whole. They are still in the process of giving us some more information, and we are working with labor relations and HR to mitigate some of those challenges, and also making sure that our employees have as much possible information so that they can make an informed decision about whether or not they want to transfer to the state. It is nuanced because there's both labor and contracts involved, as well as Oregon statutes that kind of drive this process. And while we're working with ODDS, we're also bringing in our legal counsel, Jonathan, to make sure that all of our employees' rights are protected. We also know that there's some challenges with making sure that the roles are clearly identified between case management entities, licensing, as well as our abuse and protective services roles. We want to make sure that those are clearly delineated to reduce any risk to our clients. We want to make sure that providers have the supports that they need to be responsive to, whether there's a crisis or there's immediate need. And so we do have around 8 employees who are participating in some statewide work groups to help develop that policy and procedures. And once that is done, we'll be working with Jonathan Strawhill to make sure that it's in alignment with our interagency governmental agreements. And if not, we'll be pushing for an amendment and making sure there's legal language in there to protect our community and providers. And then finally, we have been talking about what our cost reductions are. We did we developed a cost-benefit analysis, and we sent that to the state to help them understand what these changes mean, not just for the overall reduction in the workload model, but how the county is able to leverage services with the additional fees. So we currently receive about $50,000 in civil penalties through our adult care home program, and then we're able to leverage those funds for our match, and there's like about additional $133K. And that's how we're able to expand the additional services that we offer in this community. So we're still going to continue to have those conversations with the agency to make sure that they have a plan in place to support our providers. We're also continuing to talk to the agency about the actual licensing challenges, because they have a very limited amount of time when these homes need to be relicensed in order to maintain the clients that live in their current home. And that's kind of a real brief overview, but I did also develop a 2-page document that will be sent out to you all with further details.
Thank you. And if this is in the document, you can say you'll see that later. I'm not that I'm not concerned and appreciate what you all are doing around the staff. I'm also concerned about the statements that there'll be like 166, I think it was, facilities that they don't have capacity for. And additionally, that we have a higher quality expectation in our process than maybe the state one does. And does the state have a plan for tracking impacts of this change? Because the quality is a big deal for us, but also if we lose or have lags in the ability for 166 care homes to do this work, that's a big deal for us. And that's not your responsibility, it's the state's, but I'm not clear on what their plan is to actually track that.
I did talk with the ODDS director and actually with the ODHS director, Liesl Wendt, and before Faribault, we were very clear, and they assured me that they understand that any liability and risk also, they will carry those. I think we developed in Multnomah County higher, more stringent laws and rules, so I think if from their standpoint, they'll be following their own rules. But they did allow us, as part of that carve-out, to develop that higher standard. I think we are going to, what Alexis talked about earlier, we are going to work with our county council to make sure that our interagency agreement spell that out, because we want to make sure that the people we serve are also protected and safe. The other concern I have, having managed adult protective services, my concern is that our protective services is going to be called quite a bit right now, since the state may not be able to respond to these, so everything may become like a protective services, if you will. So we are in the process. They've been really very cooperative. It's something they told us that they had to do. One, they wanted to realize some savings in their budget. Two, they wanted to centralize that whole function in terms of certification and licensing in order to maintain certain standards. They assured us that they don't have any problem with us here in Multnomah County in terms of quality. We have great quality. They do have some concerns about other parts of the state, basically. But we are in continual conversation, Alexis and I, and ODDS leadership and ODHS leadership.
Thank you. I would say, and this has nothing to do with the people in those positions, but I don't frankly care about people's word or commitment. I care about what's on paper and how we can hold accountability. And so if there isn't the level of accountability that we need in our agreements with the state around this, I want to ask that we do that and ensure that we have a way to say, hey, this actually isn't working for us, and these are adjustments you may need to make because this is the impact on quality of care for our citizens. So that's where, and again, I don't mean to be disrespectful. I just don't want to take people's word.
No, fantastic. And I have to give credit to Alexis because she's the one who told me we should put this in the IGA. And so I think we have an intergovernmental agency agreement, and we're hoping to add some language to that since we won't be funded for those positions.
Great, thank you.
Any other questions for DCHS? Okay, thank you guys for being,
This isn't a question. I just want to say, because lots of times criticism happens in the boardroom, that yesterday morning I was at the ICE facility with the Portland Immigrants' Rights Coalition, and they were very appreciative of the support they're getting from your department and from the team there. And so I just want to say out loud that the people that are being impacted by enforcement and the things that are happening in our community, that there's a lot of appreciation that may not be expressed to the department. So I just want to say it out loud in public that I was the recipient of the thanks, and it's really not, I'm not the person to receive it, but I want to share it. So I want to share it.
Appreciate that.
That's great news to share. Thank you so much. Okay, appreciate everyone. We went very far over the time today, but important conversations, important work with the budget. So appreciate that. Were there any board comments that needed to be made? A quick one? Okay.
I just want to, we haven't had time for board comments, so I just want to acknowledge that I had another two of my district members kidnapped by ICE, Rafael Arreola Caballero and Felipe Aguilar Gama, both taken almost 2 weeks ago now with smashed windows and dragging people out of cars. They continue to abduct people in my community, and I just want to continue to go on the record in stating people's names and demanding our citizens be returned, or our community members be returned. Also briefly, Dawson Park Resource Fair is a Safe Blocks is hosting at October 7th from 10 to 1 at Dawson Park. So just want to encourage folks to show up there.
Thank you. Good, Commissioner Moyer.
I would just like to say, as the commissioner with the ICE facility in my district, I very frequently go to check up. I have spoken with people there, and the president's comments about what's going on in Portland, I don't need to tell this room, are entirely ludicrous. I am impressed by the response of protesters. I am impressed that we continue to use our First Amendment rights in a way that I think should make Portlanders feel proud. I have a lot of concern about what comes next, and just wanted to assure, at least from my office, because I don't speak for anybody else, but I welcome the federal government's lawsuit against us and our right to not use our local resources to violate people's constitutional rights. That is a lawsuit that is ill thought out, and I look forward to our day in court because this community stands together. And regardless of somebody's immigration status, we respect the humanity of everybody in our community. So I did hear we may have another World Naked Bike Ride protest. I don't know when it is, and I will not be participating naked for my own self-esteem related issues, but encourage people to participate in whatever form of protest to express their First Amendment rights against what's happening in our community.
Thank you, Commissioner Moyer. Commissioner Jones-Dixon.
I have to say, Commissioner Moore, you're the realest commissioner ever. So I so appreciate serving alongside you. I just want to provide an update. I had an opportunity to speak at PSU on Monday to some of the folks that are leaders and just doing that community outreach team, and most of us know it as the Youth Violence Prevention Team through POIC, and it was extremely enlightening. They asked if they can engage with our board more. It was the first time that they've talked to an elected official around just local governance and things like that. And then just hearing more about the work that they're leaning into. And then also wanted to share that I sat in the last 2 Stark Court graduations over the last 2 months, and Judge Orr, he invited me to speak yesterday at the Stark Court. Judge and one of the facilitators asked if they can come and present to the board to share more about the work that they're doing, but I left with my cup full, just hearing about folks' journey within our community and how we're supporting folks that are trying to get back on track. So I just want to share those two experiences from this week. Thank you.
Thank you, Commissioner. Commissioner Berman, any updates this week or comments?
Well, I was just going to, it's hard to follow Commissioner Moyer when she's announcing the naked bike ride, because I've informed my staff, there's like, if I ever see anything involving dancing or singing, and I'm now adding naked bike rides on my schedule, there's going to be a staff change. But I did want to just follow on Commissioner Moyer's comments. I know that we, as commissioners, have all been out in the community. And, I've been to the ICE facility a couple of mornings, but they invited me back yesterday morning just to talk to the volunteers who are working there with the Portland Immigrant Rights Coalition. And, when I asked the question, what more can we do to be helpful, in addition to them sharing their appreciation for the support they're getting from some county departments. They just asked for elected officials to continue to be present, because the message that sends to our community, but also the message it sends, because it, at least was conveyed to me, it gives a sense of like there's better behavior if elected leaders are watching what's happening. And I guess I'm just going to state for the record, as Commissioner Moyer did, like there's no war, there's no insurrection, and I think the more that we're communicating out that, because it's interesting. I have friends all over the country just because I've lived in different places, and a lot of questions about like, is it really true about what's happening in Portland? And I think we have an opportunity to just set the record straight. I'm appreciative that Portlanders have also approached this with humor about what's actually happening here versus the narrative that is being used to invoke Article 10 and mobilize the National Guard, because that is the whole, the rationale why they're spinning this narrative that's just not true, is so that they can bring in the National Guard. And the more that we sort of share actually what's really happening, I kind of got challenged when I went there at 9 o'clock in the morning, and all there was volunteers pretty much at the ICE Center to like go back at night. So I was there at 11:30 at night, and again, there was no war or insurrection happening. I also walked around downtown. I'll just note that for 2 hours, and the Central Library looked beautiful, and downtown was lit up. People were out walking around. I think we just need to continue to use our networks to share what's really happening in this community. It's not that we're without challenges, but we also have a lot of really good things happening in the community, and there is no war and there is no insurrection that needs a military response.
Thank you. I really appreciate this conversation. I will just say, from the biggest picture where we have the president like convening all of like the military leaders around the globe to talk about, the desire to have cities like ours be training grounds, which is truly a constitutional crisis in my mind, and is, I think, going to be a point where like those military leaders are going to really have to decide where they stand in terms of the Constitution and what the president is saying to the very local impacts that Commissioner Singleton, I appreciate you bringing up every time it impacts someone in the county and in your district. What is happening right now is unbelievable, and I'm really proud of the way that Portland, that Multnomah County leaders and community members alike are really pushing back against this. Even my teenage son was like, he's like, it's trending like, the war zone in Portland, and it's pictures of like roses and parks and people on their bikes. And, he's like, he was like, this is so ridiculous. And it is ridiculous. And yet it's happening. And so I just want to appreciate our community so much. I also want to appreciate all the folks who made the Hispanic and Latina Heritage Month celebration yesterday possible. We actually heard back from folks who were like, it actually felt like a regular day, like where without fear, with a chance to come together in community and celebrate. And so I just appreciate everyone who worked to make that happen. And that's something that we're trying to do in spite of all of the things that's happening around us. So I was really glad. There were, I had a list of like all sorts of different community events that are happening this weekend, just to show like life is happening, things are normal, businesses are, Salt and Straw is having a Taco Bell, tackle it, new thing. Like it is just, life is happening here in the best possible ways and really exciting Portland ways, like naked bike rides. And all of that is true. And so we just appreciate this board, appreciate the work that we can continue to lean in on that narrative and push back against what's happening. So thank you, everyone. That concludes today's regular board meeting. There being no further business, we are adjourned.